and all main media broadcasting outlets on Tuesday, March 29th, 2022, and the second notice on Friday, April 1st, 2022. Notice of today's hearing was also available on the Guam Legislature's website. Senators present with me today, can you just please bear with me? Is Senator Tony Yada. Thank you for being here. Senator Joanne Brown, Senator Tello Taidagui, okay, I think that's it. I don't see anyone else. Okay. Thank you, colleagues, for being here with us today. General rules of conduct. All must abide by the rules of conduct and quality assurance standards. Please keep video on at all times and ensure you are in a room with little interruptions and adequate lighting, specifically to make sure the participant space is visible at all times. The host of this hearing will mute participants until called upon by the chair. When you are called to speak, please ensure that you are unmuted and that you are speaking into the microphones. If there's anyone that does wish to speak and we have not called on you, just please indicate on the in-chat feature box and we will note it down and we will go on to the next person. I believe there's about 63 people here today that may want to speak, so just be patient with us as we try to call your name. Questions and testimonies shall be confined to the substance or nature of the agenda. Personal inference as to the character or motive of any senator or individual testifying is not permitted. If there are any violations of this general rule of conduct, this will result in removal from the hearing room by the host. Hafa day and good evening, everyone. The agenda item for today's hearing is Bill number 254-36 COR, which is an act to add a new chapter to Division 2 of Title 17 Guam Code Annotated, relative to defining the educational and professional requirements for certified school counselors and to authorize the compiler of laws to make changes. Bill 254 was introduced by our office at the request of various school counselors who have met with us throughout the year to discuss issues and concerns that are relative to their professional standards. This discussion first began in October of last year when constituents contacted my office with their concerns on the suicide risk assessment of students. What was brought to my attention was that there was a disconnect in communication and clarity regarding the procedures in which students who experienced suicide ideation were assisted. The Standard Procedural Assessment Manual, which is also known as the SPAM, is the guide for school counselors who work within GDOE, was shown to have conflicting information that caused much confusion amongst those who were supposed to utilize it. In the informational hearing that was held in October, I listened to school counselors who shared their experiences in working with students and how the confusion revolving the SPAM affected how they worked with their students. Because of this, I had several meetings with a number of school counselors who further explained the concerns they have relative to how they are unable to effectively carry out their duties. From these meetings, drafts of a potential bill came to being, and through collaborative efforts with the school counselors, Bill number 254-36 was created. The purpose behind this bill that we introduced stems from the school counselors who want to fulfill their duties within their appropriate scope of practice. So school counselors are not community counselors, as they seek to be proactive in responding directly to their students rather than reacting, most especially in the case of suicide ideation. The goal is for student achievement and for the wholeness of the student that involves social, emotional well-being. To meet these needs, school counselors will carry out services that are developmental and conducted regularly, planned on a systemic basis to assist students to achieve mindsets and behaviors. The appropriate programs will provide all students with the necessary experiences, knowledge, and skills, and will ensure students have learned to successfully and safely make their way in the world. From being unable to be physically present in their respective schools, and having to adapt to changes in the various modes of learning, the needs for these services is especially felt in today's environment due to the COVID-19 pandemic and its effect on the social and emotional well-being of our students. Through defining the school counselor, they will then be separated from teacher status and have their own role that will allow school counselors to help their students effectively and efficiently. Tonight, we welcome all thoughts on Bill number 254-36. And I believe we have a sign-in sheet. But first, I would like Mr. Joe Sanchez, who is the lead representative for Guam Department of Education, if he would like to make any comments or invite any members of the board to make comments and give testimony in regards to the bill. Thank you, Mr. Sanchez, and thank you for being here.
Thank you, Madam Chair, and thank you, Senators. Tonight, I know that I apologize for the superintendent. He is unable to make it tonight, but he has provided his direction and testimony to Ms. Nadine Cepeda, who's our district psychologist. So at the appropriate time, she will be able to provide the testimony on behalf of the superintendent and the DOE. I would just like to, of course, thank everybody for joining us today. Especially the DOE employees, the counselors, the teachers and school administrators. And we understand that tonight there may be some differing positions. We will, Ms. Nadine will present the official testimony from the superintendent, but I just want all of our staff here to know that we respect and we invite, all ideas, all the input that you have. So, we are prepared to, really listen, and take to heart what you have to say. I don't normally interact directly in a supervisory role with the counselors, but we communicate a lot when it comes to curriculum matters. So we really appreciate the work that you do, and especially during this time of COVID was a big challenge for a lot of us, whether it be not just academic, but even for their social and emotional health. And we really thank them for their work, all of these, especially these last 2 years, but, with ongoing, with our ongoing challenges as well. So, Madam Chair, if you wanted to go ahead and start with the testimony, Ms. Nadine can provide that for the department.
Thank you, Mr. Sanchez. Hi, Mrs. Cepeda. Nice to see you. Yes,
Senator Telena Nelson.
good to see you. Please move forward with your testimony.
Right. Half a day Chairperson Nelson and members of the Committee on Education and Infrastructure Advancement, Border Protection and Maritime Transportation, Guam Preservation and Self-Determination, and Federal and Foreign Relations. I am Nadine Cepeda, the district school psychologist for the Department of Education and also the lead coordinator for school counselors within the Student Support Services Division. On behalf of the superintendent, John Fernandez, I have reviewed Bill 254-36 in its entirety, which seeks to define the educational and professional requirements for certified school counselors within the Guam public school systems and provide the following remarks on the proposed measure. Currently, GDOE has 82 school counselors who provide school counseling and support services to our students, population of 27,497 in 41 schools district-wide. School counselors, who are also certified teachers, offer the highest standards of practice for schools and students because they have met stringent education, examination, supervision, experience, and ethical requirements in school counseling. School counselors work to maximize student success, promoting access and equity for all students. A vital member of the school leadership team, school counselors create a school culture of success for all through school counseling programs that improve student outcomes. The duties, duty day, and workload ratio are addressed within the scope of the negotiated collective bargaining agreement between GDOE and the Guam Federation of Teachers, which was last approved on November 1st, 2017, and which is in effect for 5 years. The current contract would expire on October 31st, 2022, and would therefore need to be renegotiated and renewed by November 1st, 2023. Over the next few months, representatives from the Guam Education Board, GDOE management, and GFT will meet to revisit the contract and making any adjustments needed in order to secure renewal of the contract before it expires. Because addressing the duties and responsibilities of school counselors and without addressing the duties, responsibility of other employees covered under the contract could have unintended consequences on what other employees would be expected to do and perform in light of any legislator limits on school counselors' duties. For this reason, we will recommend that the committee allow the GDOE and GFT negotiating teams to take on this issue within the context of the upcoming collaborative bargaining agreement renewal. This would allow management and union to address the proposed duties, responsibilities, and limitations within the context of all the activities that need to be addressed at the school level. Should the legislators see fit to move forward with a standalone bill for school counselors, my comments are as follows below. In an effort to redefine the educational and professional requirements for certified school counselors within the Guam public school system, Bill 254 fails to address the following concerns: crisis response, such as suicide risk, trauma, and/or violence, substance abuse, such as drugs and alcohol, mental health screeners, evidence-based practices such as motivation interviewing, client-centered, cognitive behavioral, psychoeducation, social emotional wellness, and group counseling. Additionally, Bill 254 excludes early childhood development needs, excludes mandated coordinators under Section 504 of the Rehabilitation Act of 1973, which protects the civil constructional rights of students with disabilities, and excludes virtual counseling practices and expectations. Bill 254 also fails to provide a solution to the ongoing challenges to classroom coverage due to teacher shortages and absences. Limits effective crisis response. By limiting the role of school counselors, Bill 254 intentionally limits the need for effective crisis response in our public schools by failing to define and incorporate school-based crisis response interventions due to crisis situations such as suicidal ideation, violence, trauma, and/or informed care. School-based crisis response interventions and recovery provide preventative and restorative services to students in crisis. Due to the growing trend of school violence, school counselors must be knowledgeable about trauma's damaging impact on students' well-being and academic success. According to 2021 statistics from January 1st to July 31st, Guam saw 18 deaths by suicide. There have been 33 suicide ideation cases in current and previous school year, with 19 of those students' cases referred to Guam Behavioral Health and Wellness Center. Our school counselors have been trained in Columbia Risk Assessment, which is a screener used to assess the severity and the intimacy of suicide risk. Applied suicide intervention, safe talk, and youth mental health first aid. It is the exception of school counselors to provide support and assistance to students who experience critical and emergency situations. GOD has a student assistant procedural manual, the SPAM, that allows school counselors to provide crisis response, such as suicide ideation, within their school district. Section 5 of Bill 254 intentionally eliminates the responsibility of school counselors to conduct suicide risk assessments and mental health screeners necessary to identify students who are at risk or in need of additional supports and interventions. Since trauma can have devastating effects on the developing brain, early intervention is crucial. It has been found that children who have experienced trauma are more likely to react to stressors with their fight or flight reptilian brain versus their more reasoning prefrontal cortex. The American School Counselors Association, ASCA, specified that school counselors are essential in promoting a trauma-sensitive environment in schools and are uniquely in a position to identify and provide the necessary support and recourse to students who have been affected by or exposed to traumatic events such as suicide. As school counselors are limited in using screening tools, proven to be helpful in providing effective crisis and trauma interventions, who will then be responsible for conducting suicide risk assessments and mental health screeners in schools? This duty will likely fall to other employees in the department who are not represented in this legislation. Exclusion of early childhood needs. Early childhood development refers to the sequence of physical, language, thought, and emotional changes that occur in a child from birth to the beginning of adulthood. During the preschool years, children develop a better understanding of their own and of others' feelings and behaviors and become more capable of controlling their emotions. Human brain development occurs at an astounding rate during early childhood. Brain development during early childhood lays the foundation for neural pathways and related future functioning. Early childhood, such as Head Start, pre-Gate, pre-K, are not included in Bill 254. In fact, Bill 254 excludes the responsibility of school counselors to support the developmental needs of our early childhood student population. According to the American School Counselors Association, ASCA, school counselors have unique qualification and skills to address pre-K to 12 students' academic, career, and social-emotional development needs. These standards are the ethical responsibility of all school counseling professions. If you remove the responsibility of school counselors supporting the developmental needs of our early childhood student population, who will then provide the support to them? Again, this duty will likely fall to other employees in the department who are not represented in this legislature. Limits of evidence-based practices. School counselors are in the ideal role to address the social and emotional needs and wellness as they have direct and immediate contact and access to GDOE students on school grounds. School counseling programs have introduced school counselors to various evidence-based practices, including but not limited to, and the following are motivation interviewing, cognitive and behavioral counseling, client-centered counseling, behavioral counseling, rational emotive counseling, and solution-focused brief counseling. The Masters of Arts in Counseling program at the University of Guam follows common core areas representing the fundamental knowledge required of all entry-level education graduates. One of the 8 common core areas is, quote, counseling and helping relationship, end of quote, which states, the counselor candidate understands and uses essential interviewing, counseling, and case conceptualization, theories, and models of counseling, counselor characteristics and behaviors that influence the counseling process, developmentally counseling treatment of intervention plans, evidence-based counseling strategies and techniques for prevention and intervention, strategies to promote client understanding of the access to a variety of community-based resources, a systems approach to conceptualizing clients, ethical and culturally relevant strategies for establishing and maintaining in-person and technology-assisted relationships. The impact of technology of the counseling process, consultation, theories, and their applications, suicide prevention models and strategies, crisis intervention, trauma-informed, and community-based strategies and process of aiding students in developing a personal model of counseling. Bill 254 limits the role of a school counselors by authorizing them to provide only one fit for all evidence-based practice, such as solution-focused brief counseling, to address the needs and demands of our students. By limiting school counselors to solution-focused brief counseling, effective counseling support services to students will be greatly impacted due in part of the basic understanding that each student is unique in their strengths, limitations, and needs. With students in crisis situation, who will then provide the appropriate evidence-based practices to address the complexities of a student in crisis. We submit that this duty will likely fall to other employees in the department who are not represented in this legislature. Prohibition of mental health screeners. According to ASCA website, school counselors recognize and respond to the need of mental health services that promote social emotional wellness and development of all students. School counselors advocate for the mental health needs of all students by offering instruction that enhances awareness of mental health, appraisal and advisement, addressing academic, career, social emotional development, short-term counseling interventions, and referrals to community resources of long-term support. Public Law 31-202 allows school counselors to conduct mental health screeners within the schools. Mental health screening supports GDOE schools across various multi-tiered systems of support. Our schools have been trained, our school counselors have been trained to administer and score mental health screeners through various professional development. One of the best, most effective way to identify mental health problems in students is to provide mental health screenings. An identification of an at-risk student does not involve reaching a diagnosis of a mental health condition. Screeners are standardized instruments with reliability and validity in order to determine whether students are at risk for mental health concern and or need of further assessment and treatment by a licensed mental health clinician. GDOE school counselors do conduct mental health screeners. In contrast, a mental health assessment is a process of defining the nature of a problem, determining a diagnosis, and developing a specific treatment recommendation for addressing the problem or diagnosis. Only licensed mental health professionals or medical professionals, as determined by licensing laws, are qualified to make a diagnosis. GDOE school counselors do not conduct mental health assessments. If students are referred for behavioral health issues, school counselors have the knowledge, the skills, and the tools to determine the risk level and make referrals to professionals with specialized care. For example, if a school counselor determines a student to be at high risk, a referral is made to a school psychologist with specialized training to assist the student. If a student's need is immediate, a referral to Guam Behavioral Health and Wellness Center may be warranted. Bill 25 explicit prohibits the use of mental health screeners, defining it as inappropriate duties and activities for school counselors. By defining mental health screeners as inappropriate duty for school counselors have a direct contact with students, will no longer be responsible for identifying students with possible behavioral problems, thus limiting their role in creating a safe and learning environment and further reducing the safety net needed for all students. If mental health screeners become a prohibited tool for school counselors to use for identifying students with possible behavioral problems, what tool will school counselors use when faced with the complexities of a student in crisis? Limit support of mental health. The ASCA indicates school counselors acknowledge the important need of mental health services and promote social and emotional wellness for all students. School counselors provide support for all students' mental health needs by giving instruction that increases mental health awareness, academic and career advisement, social and emotional development, school level interventions, and referrals for treatment. Bill 254 does not emphasize enough with the importance of mental health for our students in our school district. In fact, This bill lessens the responsibilities of and loosens professional discipline by a school counselor who is tasked to develop and apply school counseling programs that promote academic, career, and social and emotional achievements for students. The scope of practice for a counselor is conditional, broadly defined, and insufficient to ensure that the safety and school social and emotional well-being of our students, stating in part, quote, however, school counselors are prepared to recognize and respond to students' mental health needs and assist students and families seeking resources. Fails to address substance use challenges. GDOE recognizes the damaging effect on the normal development, well-being, and academic performance of students who use alcohol, drugs, tobacco, nicotine, and other substances. Adolescence is especially vulnerable time due to their developing brain, therefore placing young people at risk and developing long-term substance use problems and disorders. GDOE's comprehensive framework of prevention, screening, brief intervention and education, and referral has proven to be an effective program. According to the Guam State Victimological Profile 2018 update, quote, 1 in 4 high school students in Guam is a current user of marijuana. Current and lifetime marijuana use among Guam students are higher than the US median. The profile further states about 5% of Guam high school students report having tried methamphetamine. School counselors play a critical role in guiding students away from substance use, such as drug and alcohol. Many students rely on school counselors to provide a positive direction towards student success. According to ASCA, substance use, abuse, and addiction are among the leading causes of adolescent death in the United States. School counselors are typically part of that prevention program framework by presenting guidance, curriculum, lessons about character development, and peer pressure. School counselors are also positioned to offer additional prevention services for students identified at risk. Bill 254 fails to address substance use challenges on school grounds and the critical role of school counselors to provide support services to students identified at high risk. Exclusion of virtual counseling. During the COVID-19 pandemic, GDO school counselors were encouraged to conduct virtual school counseling via telephone, wellness check, Zoom, Google, and video conferencing with our GDOE students in order to ensure their academic and social emotional needs are maintained. School counselors were also provided training, virtual school counseling through professional development. Bill 254 excludes virtual school counseling as part of the scope of practice and duties of school counselors. The American School Counselors Association stated, school counselors have the responsibility to provide a school counseling program and develop programs to support all students in academic, career, and social emotional development that will emulate school counseling that will take place in face-to-face environment. Prohibits Section 504 advocacy. The school counselor plays a vital role in advocating for the needs of students with physical impairments, mental health issues, or cognitive impairments. The role of a school counselor in 504 process varies from school districts to school district. In many states, GDOE school counselors take on a unique task to coordinate the 504 process in their school. GDOE has a program coordinator at the Student Support Services Division who provides training and support to school counselors who coordinate all 504 programs. A student may be referred for 504 consideration and evaluation by a teacher, staff member, medical professional, or parent. According to Thompson and Young, the school counselor's job is to start the 504 evaluation process once a referral is received. Accommodations may help the student access their education and prevent exclusion or discrimination based on an impairment. Student accommodations are designed to level the playing field for students with disabilities and assure equal access to learning. Accommodations are never designed to enable a student with a disability. Bill 254 explicits explicitly prohibits school counselors from advocating for the needs of the students with physical impairments, mental health issues, or cognitive impairments, defining their advocacy as inappropriate duties and activities for school counselors. Group counseling, undefined. Group counseling involves students working on shared tasks and developing supportive relationships in a group setting and is efficient, effective, and positive way to provide a service to students with academic, career, and social emotional developmental issues. School counselors provide direct services such as small group counseling to students. Group settings are proven to be effective way to meet the needs of our students. Bill 254 does not explicitly define group counseling as is necessary direct student service that has been proven to be effective part of the school counseling programs. Group counseling has a positive effect on academic, career, and social emotional development and should be supported by school administrations and school districts. In fact, GDOE has provided professional development training to school counselors for the development and implementation of group counseling sessions. Restricts meaningful participation. GDOE has been experiencing a shortage of teachers with school administrators, indicating that managing the teacher shortage has serious consequences and threatens the students' ability to learn. According to the Guam Daily Post, September 20th, 2021, GDOE may be facing a district-wide shortage of 300 to 400 teachers annually. Having been certified as teachers or experienced in teaching, school counselors provide seamless support to both school administrators and students in the event a classroom needs to be covered due to a teacher shortage or absence. Bill 254 restricts school counselors from meaningful participation in the comprehensive system of support framework for student success. Bill 254 explicitly prohibits school counselors from covering classes when teachers are absent or to create teacher planning time. Meaningful dialogue encouraged. As lawmakers for our island, I encourage you to have meaningful dialogue with public school stakeholders to ensure that our collective advocacies remove barriers that prevent academic success for our students. As introduced, Bill 254 creates more barriers for students who need immediate interventions and threatens our comprehensive support system focused on student success. As introduced, GDOE does not support Bill 254-36. However, with a meaningful dialogue from all stakeholders and the immediate understanding of the interrelationships between school counselors and students, we are encouraged that this committee will take the necessary steps to ensure positive student outcomes are achieved. We respectfully encourage that these matters be addressed within the context of GDOE and GFT negotiation, which will take place over the coming months as both entities work towards renewing the collective bargaining agreement that covers similar issues for classroom teachers, school nurses, librarians, school counselors, and others. By doing so, we can address this matter within the context of how school teams are to educate and care for our students and incorporate input from school administrators and union representatives as well. Thank you for considering the department's testimony, and we look forward to working with you and caring for the needs of our public school students. Thank you, Senator Nelson.
Thank you, Mrs. Cepeda. We have multiple times reached out to GDOE to discuss the collaboration that we've been doing with the counselors, but for some reason, we were not getting any feedback. We've been working with the school counselors for several months, since last year, and I believe that they've also been waiting for a meeting with the superintendent since October. And so this is where we're at today. But I appreciate all the input that you have provided for us in the testimony on the bill. So thank you very much. Thank you for providing that perspective.
Thank
I
you,
would
Senator.
like to now call Director Ariola. Director Ariola, for your testimony, or if you have any comments or concerns. Thank you.
Thank you, Senator Nelson, the committee, good senators of the legislature, and of course, Department of Education administrators and counselors in the Zoom room. I would like to say that, first of all, Senator, we will be submitting written testimony with our comments as well as some recommendation to Bill 254 within the 10-day period. However, just for some general statements, first of all, I feel like this bill is a matter of establishing the scope of work of what a school counselor is expected and the expectations of the school counselor. And for that reason alone, I fully support every position, anybody being hired needs to know exactly what their expectations are. So in that respect, I support the effort. However, as Guam Behavioral Health and Wellness Center, the state mental health authority and substance use authority here in the island, I do have grave concerns about how the bill is written. First of all, we partner very well with with GDOE school counselors. We need them. We need school counselors to be the counselors that they went to school and they expected to perform. I just want to say in comparison, Guam Behavioral Health and Wellness Center has 5 counselors in the Children and Adolescent Service Division, CASD, or some of you, most of you know as IFA Magonta. 5 versus the 82 school counselors that a GDOE currently has. So our concern really stems from school counselors not being able to do suicide screening and assessment. We really do run the risk of keeping hidden those students that are feelings of suicide and self-harm. Or we run the risk of school counselors telling those students to wait for those feelings until a mental health counselor, which I'm assuming is Guam Behavioral Health and Wellness Center counselors, to get to them, even though we have 5 counselors. And ultimately, and this is a very bold statement and not meant to offend anybody, but if the school counselors are not able to do suicide screening for the students that are obviously struggling and having signs and waiting for all the referrals to go to Guam Behavioral Health and Wellness Center, my fear is that ultimately we run the risk of there being an increase of child and youth deaths by suicide at a time when youth deaths are really high by suicide. And again, I really do believe that this cry for Bill 254 or cry, I heard earlier that you've been working with the counselors with regards to this for several months. And it really does look like a cry for clarity of what school counselors are expected to do. But as counselors, we see them as a vital partner with Guam Behavioral Health. And without them doing the school screenings for suicide, we really run the risk of letting kids slip through the cracks and waiting for Guam Behavioral Health, who has far less counselors than GDOE, to get to them, which at this point will never be and is really at a high risk. Actually, it's negligent in that sense with us only having 5 counselors. Today, how it works, the school counselor handles a lot of things that they can handle at their level and then recommends to the school district psychologist more complex. And then if they need more severe intensive training or intensive services, is referred to Guam Behavioral Health. there's a stepping stone of services that Guam Behavioral Health and GDOE has established. And so that's really the major concern we have that's greatly impacting Guam Behavioral Health and Wellness Center. Without the help of our counselors who went to school to help in this regard, our island kids are going to be in great jeopardy of not being able to be screened and helped immediately, where the school counselors are with them on a daily basis. And I really think that's really a lot already. I'm just really, really concerned that if we lose that connection of partnership with the school counselors and Guam Behavioral Health, that our kids going to be in jeopardy, and we're going to see higher numbers of death by suicide for public school kids. I do have written testimony that will be provided more in depth than, but that's really the general concern. Is when I read the bill, I'm very concerned about the detachment of school counselors from suicide and mental health screening. So I appreciate the time. This is the first I've seen of it, of the bill. And so if you could allow me some time to work with my staff in providing a written testimony, it'll be more in depth and more in detail. So thank you very much for this time. And I appreciate everyone's time, and have a good evening. I hope it's not too long before you all have some dinner.
Thank you, Director Ariola.
Thank you, Senator.
I will now like to call on Ms. Leilani P. Guerrero.
Thank you so much. I'm here. I have written testimony that I'm going to read straight from my document that I supported, or that I supplied to your office, Senator Nelson, as well as to all the senators on the sitting legislature. Okay.
Sure, yeah, go. Please proceed.
Okay. So I am a parent, I'm an educator, and I am a school counselor. I also teach up at the university, the school counseling programs. And without rebutting anything that's already been said, let me just go through this. I am in favor and support of Bill 254-36. I was also sitting on the negotiating table when we created the contract in 2017. And some of the statements that I've said, it kind of bothersome because it actually contradicts what is currently stated in the contract. Buenas and Hafa honorable senators of the 36th Guam Legislature, Committee on Education, fellow educators, community members, parents, students, and my colleagues who are school counselors in this beautiful island of Guam. I come to you today to provide written and oral testimony to advocate for students and professional certified school counselors in support of this bill. As a former school counselor in the Guam Department of Education, a current adjunct professor at the University of Guam teaching school counseling programs, a member of the American School Counselor Association, here known as ASCA, and a board of director and member of the Guam Association of School Counselors, I would like to provide my statements in support of Bill 254-36, and to humbly request for our island leaders to consider the passing of this bill into law, which defines what a school counselor is and does at the elementary, middle, and high school levels, stipulates and informs all stakeholders within the community and the qualifications for certification of a school counselor as per the Guam Commission for Educator Certification. This bill lists the appropriate duties and activities of a school counselor versus a community counselor, which are two separate paths at the university that students can choose from. It provides for our students and school communities versus what is deemed inappropriate according to the ASCA, and explains and clarifies the professional standards, competencies, and ethical codes of conduct for school counselors, and provides for a provision to create a position for an experienced and certified school counselor director or coordinator at the district level to help lead and guide school counselors across the island. Every aspect of this bill is written to promote and protect the services that school counselors can and should provide to all students, which are non-negotiable. It is important to point out that much of the provisions written in this bill are provided and backed by the American School Counselor Association, to include the position statements that are provided within the ASCA. These position statements, by the way, cover crisis intervention. Cover crisis intervention, substance abuse, suicide ideation. And there are over, I should have the exact number of these position statements that we follow at the school counseling level. It also talks about evidence-based practices and covers the virtual counseling practices of school counselors. Again, you can find that in our position statements from the American School Counselor Association. It's backed by the American School Counselor Association, which is the professional organization who oversees and guides our profession. From the ASCA, we obtain our school counselor proficiencies and competencies, our ethical standards, the mindsets and behavioral standards of not only the school counselor, but the mindsets and behavior standards of what we want all of our students to exhibit as they prepare to be college and career ready before graduating high school. The mindsets and behavior standards, which school counselors implement and encourage for all students, begins at the elementary level. School counselors advocate, we lead, we collaborate with other professionals, to include the Guam Behavioral Health and Wellness Center. And we are the agents for systemic change to ensure the diversity, equity, and inclusion of all students. These are the 4 pillars of the ASCA national model that provides for a data-driven, comprehensive school counseling program to be implemented at every school and for all students. These 4 pillars and the ability to provide a comprehensive, data-driven school counseling program using best practices is based on the ASCA national model and is non-negotiable. Bill 25436, which we would like to become law, stipulates what it is or what is considered appropriate versus inappropriate school counseling. What this bill answers are questions such as these: versus who and what are school counselors? What services should school counselors be providing to every student? What should school counselors be doing at the school site to support all of our students so that they are college and career ready? This bill, which we want to become law, seeks to educate all members of the community, to include our fellow educators, our families, and most importantly, our students, of what their school counselors should be doing to fulfill their duties and responsibilities, as currently too many are tasked with inappropriate duties versus appropriate duties. Some non-school counseling duties that take them away from providing these services to our students. By placing what is stipulated in this bill into a separate chapter of the existing law, which is not a standalone bill or standalone law, the practice and question of what school counselors do will no longer be questioned, assumed, or permitted. This bill supports and advocates for our students, who are precious and the most important stakeholders in our schools. And we will address every aspect of the child to include their mental health. I, along with my fellow board members and of the GASC, members of the ASCA, and even those who are not members of these associations, are here to advocate for our students by advocating for our profession. We have attempted to make our voices known by discussing this with others in the past. We have filed complaints with our administrators and district level leaders. We have had conversations in hopes of change with those who have been chosen to oversee us, and we have taken our concerns to the Guam Federation of Teachers with little to no change. Our roles, duties, and responsibilities as school counselors, that of which we were trained to do, cannot be negotiated in a contract, as even today, what is written in the GDOE GFT BUC is often overlooked, bypassed, and sometimes even ignored. And just for your information, I sat on the negotiation table, so I'm very well aware of what the contract states. There are other things that can be negotiated. I can attest to this as a former GFT union steward, but not the provisions of this bill. Perhaps duty hours and duty pay, but not what we should be doing, which defines us as school counselors. I've witnessed, as well as personally experienced over too many years, the inconsistencies of what a school counselor does versus what they should be doing, as we are continuously tasked with duties that take us away from the focus of our students, and the percentage of time that we should be focused on our children. 80% of our time should be focused on the direct and indirect services to our students. The duties that are listed that are deemed inappropriate by the American School Counselor Association include, but is not limited to, sitting in or substituting for the administrator, disciplining students, substituting classes, coordinating district-wide assessments, facilitating and organizing child or student study teams in 504 meetings, providing long-term counseling to address psychological disorders, and heading accreditation, for example. This is all stipulated by the American School Counseling Association. We need to allow school counselors to do what they are intended to do so the focus can remain on the academic, the career, and the social emotional development, advisement, and counseling of our students. This is what your school counselors do, whether they're in the GDOE, DODEA, private schools. We address the needs of our students. I think that's the reason why I get a little upset to hear something that it's counteracted to what we do. And I'm sure that many school counselors here can attest to that. This can be guaranteed, by the way, by the passing of this bill. Due to the grievance of 25 school counselors from the Guam Department of Education who stood up to say no more did the provisions of this bill come about. We are able to meet and gain support from a few of our honorable senators, but we would like to gain all of your support for this bill. Whether you are a sitting senator, parent, educator, administrator, student, or a fellow counselor. As I conclude, I would like to thank and acknowledge Senator Telena Nelson and Senator Amanda Shelton, Ms. Kaylin Mennel from the Good Senator's Office, and my fellow school counselors and board members of the GAS for standing with me today to ask for your support humbly and respectfully. The purpose of this bill can only help to strengthen what we do to help, to care for, and to encourage and support our students. So please help us to pass this bill into law. After all, our services, our roles, duties, and responsibilities should not be negotiated in a contract, but set forth as a standard for all school counselors on the island of Guam to follow, as noted by the American School Counselor Association. I believe that if we allow school counselors to do what they should be doing, what they are intended to do at the school site based on their education and training, we can truly effect change to ensure the success and achievement for all of our students. In closing, I would like to also take the time to reiterate that we are no longer known as school guidance counselors, reinforcing what we do that surpasses just guiding students. Simply, though not at all simple, we are known as school counselors. Thank you very much for your time, and thank you again for your support.
Thank you, Leilani. I'll now call on Ramona Nelson to give her testimony.
Happy day, Senator Nelson. Before I read my testimony, I would just like to acknowledge some of the statements provided by our past speakers. First off, I am a certified school counselor. However, I am not a certified teacher. So I'd like to make the distinction that that's a completely separate certification. Also, our SOP, GDOE's SOP 1200-21, Guam School Counselor Program K-12, is what we currently follow, and we heard from Lonnie previously. That also includes a lot of the activities and the services we provide that we had heard previously that their bill excludes. So I would like to also address that. Thirdly, I appreciate Ms. Ariola's support for the bill, and I would like to acknowledge that her staff and her staff and myself and several others GDOE counselors served on the Inadahi committee several years ago. So we worked together to really kind of bridge the gap between GDOE and Guam Behavioral Health and Wellness Center and kind of streamline the referrals. So, you know, we really appreciate that commitment to partnering, and I look forward to working more with Guam Behavioral Health and Wellness. Okay. So now I begin. Happy Senator Nelson, Siduis Ma'asi for allowing me the opportunity to speak before you. Then Siduis Ma'asi to Senator Ada, Senator Taitagui, Senator Brown, and Senator Shelton. Guahu C. Ramona Nelson. As a member of the Guam Association of School Counselors, and more importantly, as a mother of a public school student, I feel strongly that Bill 254-36 is necessary and significant in order to strengthen the role of school counselors on Guam. Primarily, this bill comes at a crucial time for our island since the mental health of our people has been at the forefront of conversations over the past 2 years due to the COVID-19 pandemic. Before I share my why, the reason I'm here this evening, let me begin by stating that I'm blessed to work alongside some of the best colleagues I could ask for at Vicente San Agustin Benavente Middle School. I have supportive administrators, helpful staff, an inspiring team of educators, a librarian, and a school nurse. I have witnessed the dedication that they have for our students, keeping them safe, all while trying to ensure that they receive the best education possible. Currently, I support 314 sixth grade students. Some years, I have been assigned up to 420 students. While that amount may not sound alarming to you, I would like to point out that they are not simply numbers to me. Each student that I interact with is a young, pre-adolescent individual undergoing significant brain growth, in addition to having a unique set of experiences, beliefs, and temperament. As I prepared this testimony, I was reminded of several events that greatly impacted me in my career. And I wondered if this is the right place to share about the tragic loss of an amazing student due to suicide during my year as a temporary certified counselor. And how after informing the administrator at the time, I was instructed to sit through a meeting for summer school and submit a report due at the end of the day. Or how once I assisted my coworker on the roof of our school cafeteria because the student threatened to jump off, and how terrifying that ambulance ride to GMH was. Perhaps the most piercing memory was the time I expressed my frustration to a previous administrator regarding a student who had an immensely heartbreaking story. I had disclosed that I felt helpless and that I wanted to do so much more to help that student, to which my administrator replied, "You can't save them all." I share these brief examples because when it comes down to it, the well-being of our students is simply too important to not act, and we must do everything in our power to help them. This bill is very timely, and it is currently GDOE's testing period for our district-wide assessment. Year after year, school counselors have sought the support of the GDOE administration to remove this task from our plate, yet this will mark the 9th year that I've had to serve as a coordinator. Coordinating tests for hundreds of students is tedious and time-consuming. It requires great attention to detail and involves a plethora of factors to take into consideration, such as student schedules and individual accommodations on top of actual test day logistics. Before and during the testing period, it is often difficult, if not impossible, to see students. I hope that one outcome from this bill's passing is that school counselors will no longer be responsible for planning future assessments. Despite being very busy preparing for these tests, this past month alone, I have been to CPS twice to submit referrals for suspected abuse. And I have seen over 10 students for cutting. With each student that demonstrates self-harm or expresses suicidal ideations, I am responsible for informing their parent or guardian. And let me tell you, these calls never get easier. This bill, however, provides some reassurance, at least to myself, since it identifies assessing the level of risk for suicide and assessing and screening mental health disorders as inappropriate duties. So that you may understand why I breathe a sigh of relief each time I read that section, I would like to read an excerpt from an article written by ASCA Ethics Chair Carolyn Stone. Suicide assessments are inaccurate at best and dangerous at worst. The principles as established in Easel versus Board of Education of Montgomery County 1991 have informed the norms, customs, mores, and values regarding school counselors' role in assessing suicidal students and have been written in the ASCA ethical standards for school counselors. Suicide is devastating to all. School counseling professionals owe it to themselves, their district, their students, and parents to get their suicidal ideation right. Often, there are no second chances. Dr. Stone continued to write, "If you have advocated against quantifying the lethality of suicide and lost the battle, win the war." As a former coach for positive behavior interventions and support, also known as PBIS, I have developed a deep appreciation for clearly defined expectations, and I believe more efforts must be made in the way of prevention. I anticipate that with the clarity this bill brings, school counselors will be able to integrate their school counseling programs into the PBIS framework so that students can truly benefit from a multi-tiered systems of support. Similarly, along the lines of PBIS, I believe that well-written policies have the power to prevent potential problems. As the district overseeing the education of thousands of students, it is imperative that our policies are relevant, concise, and free from grammatical errors. With the passing of this bill, the idea of having a school counselor, director, coordinator may finally become a reality. This individual can assist with the development of school counseling programs and solicit counselor input when it is time to revise existing policies or create new ones. Now, I'm aware that all new positions must first jump through some budgetary hoops. However, I would like to point out that GDOE currently employs a community health and nursing services administrator, a social service supervisor, a school resource officer supervisor. So this proposed position would be consistent with having a lead at the district level. Additionally, there are 4 district psychologists, and GDOE intends to hire psychologists each fiscal year as stated on the Student Support Services Division website. Therefore, I am confident that GDOE will identify a funding source necessary to hire a school counselor, director, coordinator. Not only will this bill ensure consistency among school counselors regarding their job duties, it will also promote uniformity in the use of the title school counselor. We are often misidentified as school guidance counselors in SOPs, memos, and the media. This official acknowledgement reflects the comprehensive approach that school counselors must undertake, wherein the focus is on providing emotional support, interventions, social development, academic guidance, and career planning. I would like to note that school counselor is also the title used by the Guam Commission for Educator Certification. Although this may seem rather trivial, one must only look at previously passed local laws related to name changes. For instance, Inarohan was changed to Inalahan, and the Department of Mental Health and Substance Abuse was changed to Guam Behavioral Health and Wellness Center. These changes highlight the importance that a name has on its community. Before I conclude my testimony, I would be remiss if I did not share that I was one of the 25 school counselors that filed a grievance last school year. Although I am mindful of the fact that this is not the venue to resolve a workplace complaint, I do believe that it is important that our parents and stakeholders are aware that the concerns outlined in the grievance have yet to be addressed. This is important as the policies listed in the grievance impact roughly 27,000 GDOE students. Since the superintendent signed the grievance committee's recommendations on July 30th, 2021, and then approves SOP 1200-23 on August 3rd, 2021, which I might add is the very document that was addressed in the grievance, I attempted to seek clarification as the documents appeared to conflict with one another. Specifically, I sought guidance from GDOE's Equal Employment Opportunity Officer, as well as the Guam Federation of Teachers. GFT advised that I should email the superintendent and simply ask him of his intentions. Therefore, I sent an email on August 13, 2021, and a follow-up email on August 19, 2021 to the superintendent asking for information. I received an email nearly 2 months later, dated October 5th, 2021, that read, "Unfortunately, we have not had an opportunity to address all matters set forth as recommendations from the grievance committee. However, I will work with Deputy Superintendent Erica Cruz to put in place a process to work through these items." That same day, another email from the superintendent was sent out, wherein he stated that he would be calling for a meeting with all school counselors as soon as he could find time to address the issues that were previously presented, such as the grievance and the concerns outlined in Senator Nelson's letter. That evening, I attended the virtual roundtable hearing that was conducted by Senator Nelson, and unfortunately, due to time constraints, I was unable to share my concerns then, as the hearing was called to recess. I was confident, though, that after garnering attention from the superintendent, school counselors would finally receive assistance in addressing our concerns in order to move forward. However, that has not yet happened. After numerous inquiries were made by fellow school counselors regarding professional development opportunities for the school year, an email was sent on February 9th, 2022, from the Student Support Services Administrator. The email stated, "Moving forward with PD may be pointless unless school counselors hear directly from the superintendent regarding his vision and guidance for school counselor duties. Consequently, I believe this bill, if passed, will fulfill the need for transparency, since the role of school counselors is clearly articulated in it, and unless amended, it will remain the law despite whoever serves in the capacity of the superintendent." In closing, I have tried to the best of my abilities to find a resolution to the concerns that I've encountered over the course of my career. From meeting with my school administrators, the former deputy superintendent of educational support and community learning, reaching out to the Board of Education, and consulting with GDOE's employee management relations officer. So whether or not this bill passes, I will continue to advocate for my students and my profession. I humbly ask you now, our distinguished senators of the 36th Guam legislature, will you be the ones to finally help school counselors do the job that they were hired to do? Now, Senator Nelson, although that was my testimony, I humbly ask if I may read the testimony of a school counselor who wishes to remain anonymous.
Please proceed.
Again, this is not for me. Okay. I'm so tired of hearing counselors are lazy. Counselors don't want to work. Counselors think they're better than, above others. I am a school counselor and I'm hardworking, dedicated, and passionate about my profession. Unfortunately, this sometimes means advocating for my students by saying no to additional duties that can easily be done by someone without my specific skills. There is nothing hidden in or manipulative about Bill 254-36. It is simply meant to describe the role of the school counselor in all Guam schools and to educate those who don't know what school counselors do. Do you know what a school counselor does? Does he or she merely sit behind a desk all day and change student schedules? Or do they file things like report cards and test results in student cumulative files? Or do they photocopy documents and set up meetings? Are these tasks what you'd want someone earning a master's level paycheck to do? Or after everything you've seen or read in the news about the pandemic's impact on the mental health of our youth today, would you want certified school counselors meeting one-on-one with or in small groups with students, providing support, teaching and connecting students to helpful and oftentimes much needed resources? School counselors are specifically trained to deliver a comprehensive school counseling program to all students, which enhances academic achievement, promotes healthy social emotional development, and which supports student acquisition of college and career readiness skills. School counselors have expertise in their professional toolbox that, when appropriately employed, has the potential to positively impact all our island children, and thereby the community as a whole. I can't see why someone wouldn't be vested in Bill 254-36. It isn't just about school counselors, but about the entire community. School counselors who are afforded the time to be proactive as opposed to reactive, and who are supported by district leadership, can have a profound impact on student well-being on the front lines at schools, where many issues can be solved before they develop into systemic problems. Recently, as I sat in a virtual training on how to conduct 504 eligibility meetings, a student was referred to me with possible suicidal ideation. As the meeting went on in Zoom, I struggled to maintain focus on my student who really needed my help. In the end, I tuned the meeting out and tuned into my student. She needed me more. But later I found myself asking how I even ended up in that situation. Why was I being asked to make a choice between becoming a better coordinator, that is filling out paperwork, scheduling meetings, and collecting documentation, or helping a student who might be thinking about ending her life? It's district-wide assessment, or DWA time. This is when almost every school on island makes all their students take standardized achievement tests. In order to do this, mass testing must be coordinated at every school site. So every year, the lazy school counselors are usually tasked with the job of DWA site coordinators. I could have used a class in coordinating special programs, in case anyone from UOG's School of Ed is listening to this. Today, as I clicked boxes and enrolled students into various test sessions, my colleague outside my office announced that 2 students were outside waiting to see me. I went through a range of emotions: annoyance at having to stop in the middle of creating a session, happiness that I could stop because my eyes were blurred from staring at my computer screen and student rosters for so long, and confusion that I was annoyed at having to stop. I was confused because, in fact, I am not lazy. And actually, I don't mind helping whenever asked to do something outside the scope of my job. However, the confusion was a result of the conflict between me wanting to help this task and doing my job. Why was I annoyed at having to stop? If anything, I could have felt at that time and later realized as I put away my DWA materials and opened my counselor toolbox containing empathy, short-term cognitive behavioral and counseling skills, and unconditional positive regard, that I was grateful my student came to see me. As a result, I ended up contacting a parent and ensuring the safety of a student. If I have to work over spring break to meet the DWA deadlines, so be it. Counselors are not lazy. True, the DDOE has a collective bargaining agreement, but more is needed. Senators, this bill sets the bar very high for school counselors. So high that some school counselors may find it scary and therefore difficult to support. But there are so many things in this bill that only make Guam school counselors better at what they do. Please pass this bill and give us the support we need to continue advocating for our students, especially when we find it hard to say no. Thank you again for allowing me to share that.
Thank you, Ramona. I'd now like to call on Miss Amy Castro. Ms. Castro, can you please turn on your camera? Oh, there you are. Okay.
Hello. Hello. Are you able to hear me, Senator Nelson? Are you able to?
You're a little broken up.
How about now? Can you hear me clearly?
Yes.
Okay. Pt.1, buenas, and thank you for allowing me to speak. I'm a parent. I don't have any prepared speech today, but I found out that you guys are having this testimony or public hearing, and I'd like to speak on behalf of the voice of my children, the voice of my brother, and the voice of a young lady who experienced a very negative situation. So I'm going to talk about my daughter. My daughter was placed in an English class last school year. She was in the roster for a teacher, but what happened was they didn't know that she was not in the classroom. I realized that when my daughter didn't have a grade for English 10. I immediately contacted the principal, and they brought it up to the other teacher or the current teacher, and he didn't know that my child was in his roster. I didn't know that teacher quit. So my daughter didn't earn a credit for English 10. It was really hard during COVID because my daughter was an A student, and her grades, plummeted with the online situation where teachers were adjusting to online instruction, who were accustomed to traditional style teaching, like traditional methods, right? So anyhow, I made it, a point that when this school year began, that I would contact the guidance counselor, the principal, to make sure that my daughter, how we're going to address this situation. And what had happened was I was told by the counselor that my daughter was good with her credits, but I knew something was wrong, ma'am. I knew something was wrong because English is a core requirement. And even if the counselor told me that my daughter was good with the credits, I asked her, if my daughter didn't finish English 10, will she graduate? And she said no. And she was trying to recommend that my daughter do it in her senior year, which is English 12 and English 10, taking it simultaneously. And I didn't agree to that. I didn't think it was fair to my child. And my daughter, I'll tell you, it depressed her so much, that she was feeling like, left out, left behind, forgotten. I, as a parent, was I mean, I'm busy, but I have to make time because I have to advocate for my child, my kids. And I was really shocked, and even when my daughter, she's very proactive about her education. She even tries to go in and meet with a counselor. And I found out that she had to take a PE class because they made her take health twice. Why? I asked, why is this happening in our school system? Why is this happening? If I wasn't a parent that advocated for their kid, the kids, my child could be how do you say that? Be lost. By the time they come to senior year, we're gonna all be rushing or not making the to meet graduation requirements. So that's why I asked, I wanted to see my daughter's student transcript. I want to know every academic year, parents need to know, where does our children stand? What grades have they met? What credits have they met? And I'm wondering, why isn't there is student focus? My oldest daughter graduated in 2018. I've never met a counselor. My daughter, wasn't she didn't have issues, but it would have been nice if I would meet the counselor just to, touch base with me as a parent. And that's not happening. It didn't happen. I see the problems happening right now with my kids, and I'm very proactive. I'm very communicative with the current counselor. I didn't fault her for what happened because she told me that she wasn't there at the school last school year. So I made it clear. I am the parent of these two students, and I need to know. I am not going to be waiting for last minute where you guys are going to tell me that my child didn't make it or didn't graduate or whatever because they're lacking credits. We parents need to know. Students need to know. Why isn't there enough time for the students? Why isn't there enough time for parents to be in the know? Why aren't counselors reaching out to parents? If the mission of GDOE is to graduate every student, I tell you, I saw depressed, ma'am, depressed. I told her we're gonna get through this. How could an A student, how could she fall through the cracks? I was even getting frustrated. Okay, this should not be happening to our students. But now I understand why. And here I am thinking, why is the counselors not doing their job? They're overwhelmed. They're so overwhelmed. You have 400, as I heard from the previous speakers. For how many students? One counselor for 420 students? How do you think these students are going to have time to see their counselor? And, there's other things that I went through and experienced. My brother was supposed to graduate in he was supposed to be part of the graduating class ceremony. My stepdaughter graduated the same year as him. My family, my mother, my parents did not know that he made it. I was outside University of Guam because my other half went in to represent his daughter. I was outside feeling so sad that my brother didn't make it to graduating class. I paid for his muzao. What happened? The next day they called us to tell us that, Miss Yoshida, your son graduated. We were robbed of that, ma'am. We were robbed of that. We didn't know that my brother made it. We didn't get to celebrate. We didn't get to snap pictures of that moment, of that precious moment, because he fell through the cracks. Could it be that they're just so overwhelmed with other responsibilities that they couldn't focus on contacting my mother or contacting the student or contacting us parents? There's really a lack of communication going on. I don't feel it's student focused. And if the mission of GDOE is to graduate every student, then we need to be in the know. Students need to be in the know. Counselors need to be there and guide these students forward. Another incident, I met this young lady last year. She had some problems. She had problems in the home front. She didn't finish her school. And I thought, okay, you shouldn't be too far behind. You shouldn't be lacking too much credits. So I thought, I took her to her school, her former school, and we picked up the transcript. I was trying to introduce her to programs like GCC Adult High School or SMUZAL to see whether she can get assisted because she's 27 years old, jobless, no skills, nothing. I was shocked. I was so shocked that she only had 4 credits of high school. How could that be? How could she be a student that fell through the cracks? She cried and she sobbed because of what happened to her. And I told her it wasn't her fault. I told her that I'm sorry. I'm sorry that what happened to you. But, you know, everything in your environment that was happening, I can't speak for that, but I didn't understand how the counselors or the school system, you know, she fell off the radar. And so right now, you know, she doesn't have any job. She's unemployed, no job skills, nothing. And so I don't want that of my children because I want them to finish their school, of course. And how many other students are going through this? I think counselors really need to sit down with their students and meet and greet, introduce themselves, even to parents, because we need to be in the know. I need to know what's going on. And that is not what's happening. Because if they're too busy doing paperwork, they're too busy coordinating, they're too busy covering the classrooms, how can they possibly focus on the students? Is that in line with the mission? There are students out there that are in need to speak to counselors. But if their counselors are unavailable, how can that be achieved? I didn't understand what was happening. All I was thinking as a parent is, are they doing their job? You know, I don't know. I was blindsided because I'm not there to see the overwhelming responsibilities that counselors have. I'm not saying that they shouldn't do other programs or whatnot, but I think that either they hire more counselors, hire more coordinators, but ensure that the counselors are available to help students be career ready, help students either choose the path that they want to be, whether they want to go to college or they want to go to the trades academy or they want to go to GCC. Get them prepared. Get them to know where they're standing at each academic year. If most of you are aware, or most of the counselors who have, I'm sure most of them or administrators have gone to the University of Guam. It's clear cut. When you sign into your web advisor, it's there to tell you what you need to take in order to get your degree. It's just there. Your grade, what you earn, and the credits you earn. We don't need to go see an advisor every day to tell us what's going on. And I think as parents, that should be also, you know, available to us, whether in hard copy or whether the counselor gives us that information or whether it's available online with the online portal. But we need to be in the know. We need to know what's happening with our children. We're not going to wait to the senior year for counselors to tell us the bad news that, oh, you're lacking credits. No, we need to know. Counselors need to communicate with us parents and tell us what is going on so that we can ensure that our students graduate meet those credit requirements so that they can graduate. Because if they don't graduate, what's going to happen? It's a domino effect. They're going to resort to drugs. They're going to resort to crime. They're going to resort to dependency. And then we failed, right? The system failed, right? So what is the mission? We need to start supporting our students. We need to start having parental involvement, us in the know. And I really don't feel like I'm in the know right now. And that is exactly why I am coming on today. I don't have a prepared speech. I don't have no fancy speech, but I'm speaking from the heart of what I see, what has been done to my child, what has been the injustice that was done to my brother, the injustice that was done to the poor young lady who fell through the cracks. How can we do that to our students? Every night I think, or every day I think about that young lady. How could that have happened? Or my brother who was robbed from his ceremony because there was no communication line. To my parents who we don't even have any photographs to celebrate his milestone. Can you imagine if that was you as a parent to get the news that your kid graduated, but due to lack of communication, you were not informed that they made it through graduation? Or my daughter, who, if I wasn't as active as I am, could be suffering on her senior year, taking simultaneously English 10 and English 12. This can no longer happen to our students. They deserve better. We parents need to advocate for our kids. And I really thank everybody that came on today to advocate for the students. Because I'm not saying those programs are not important. I'm sure they are. But what is the mission? If the mission is to ensure that each GDOE student graduate, then what are we doing? What are we doing to guide these students forward? Because right now, and all of this can be verified, okay? And injustice to that young girl who did not graduate.
Ms. Castro,
And almost, yes.
can you please just wrap it up? There's still a long line of people who'd like to give testimony as well. Thank you.
Yes, okay. Other than that, ma'am, thank you so much for giving me the opportunity. I'm just, like I said, expressing my voice as a parent. And I'm just passionate about this because I just don't want any other students to go through this situation. Thank you.
Thank you. And thank you for spending time to come online and also make us aware and give us perspective into the situation. So we really appreciate that. Okay, I would now like to call on Mr. James Petit. Hi, Mr. Petit, would you like to give testimony or?
Well, yes, thank you very much, Senator Nelson, for allowing me to just kind of share some thoughts that I have, about this, about your bill.
Could you please just speak up into the microphone, come a little closer perhaps?
Okay, can you hear me now?
Yes, a little bit better, thank you.
Okay, hold on. Let me make sure this thing is turned up all the way. Okay, can you hear me now?
Yes.
Okay. So, when I was looking through your bill, I mean, I just have some questions about, some of the things that were stated that were inappropriate for counselors to do. And, I have one of my former counselors and one of my former teachers on this panel today. When we talk about building master schedules for students, that is extremely important. And that, when I first came into administration, I think in 1998, my first introduction to being an assistant principal was creating these dummy schedules because the master schedule was all messed up. Okay. no kids should, on the first day of school, those kids should be ready to go to their class, not to a cafeteria, not to the counselor's office waiting for somebody to schedule them. They need that to be done. And, although, they can't build a master schedule, their input is extremely important when it comes to scheduling. And I think that counselors do have some responsibility in that area, not as much as, the school administrator has, because anything that ever happens on your campus, that principal is responsible for. Okay, so that was on page 15, section 5, line B, the inappropriate and appropriate. So here on line 20 of that same page, I don't know, sorry, line 16, page 8, page 16, line 8, maintaining student records. When we talk about these little sessions we have with students, those things need to be documented. So I think I have a little, an issue with that. The mental health screening, that's kind of a gray area because, school counselors are tasked with, those 3 domains: the academic domain, the emotional, social domain, and that occupation domain in GDOE. So if I was to, if somebody told me I needed to do this and I was a social worker, I was a counselor, teacher, and I became a principal when I retired, mental health screening, what kind of psychometric are they going to use, right? Are these counselors able to do it? Because in my time, the Nelson reading was an assessment they gave to kids, the RAT for the math. But those things don't talk about anything other than academic challenges that these kids may have or their current functioning level. So my question would be, what if they're going to use a screening tool? These counselors need to be well versed in what that is, and what the purpose is for that. And I don't think that the counselor's expertise in that particular, diagnosing or mental health disorders, that's a specialized concentration, right? So, it takes, certain credentialing even to become a professional counselor through the Guam LRB Board of Examiners. So, if you ever wanted to be certified like school psychologist, right? Personal counselors, it requires 3,000 hours of direct client interaction. So if we take, let's say, for every pay period, in GDOE or the government of Guam for that matter, there's 26. So if we dedicate 40 hours every 2 weeks to the 26 pay periods, they're not even they won't have enough. It'll take them several years to meet that standard if it's approached like that. But, we need to set standards. And I know that some of the, like Ramona Nelson, she was a former student at Telena. It's always nice to see them, when they grow up and they succeed. She and I have had many conversations about that. They need to know, what they're doing. There needs to be a clear line of those expectations because, as school people that are passionate about students, right, their academic success, what's going on at home, the principal is a leader, right? So they set the tone, right, for that campus. The teachers, they all need to be passionate about what they do. And if they're not, that one of the responses, I think it was one of the young ladies, I think it may have been Ramona, that, she said she had a very supportive administration, teachers, wonderful group of people working with. And then you have some, administrators that may be a little jaded because of burnout. They're not as passionate as maybe some of the counselors, some of the teachers would be when it comes to making sure those kids get what they need when they go to school. Because you have to be in the know. You need to, like that parent says, you want to be in the know, right? So if you open those lines of communication with parents and stuff, and
Mr. Petit, do you have anything for the bill?
yes,
Um,
so
Because there,
no,
we
no,
have a
it was
long
those two
line of people
sections.
that are in line.
Okay, I'll make it real brief.
Thank you.
So, we need to think about, the mental health screening issue and the master scheduling, because that, those things take time, right? And the first thing, on the first day of school, you don't want kids coming to school with no schedule. So I think that that's something that needs to be considered in your bill. Thank you.
Thank you. I'll now call on Ms. Marie Holleran. Is she here? Okay. I don't think Ms. Marie Holleran, are you here? Would you like to give testimony?
I believe she's on mute.
Oh, okay. Ms. Holleran, can you please unmute yourself? Okay, we'll go on to the next speaker.
There. Hello. Can you
Okay.
hear me
Hi.
now?
Yes.
So sorry. Yeah, okay. Again, I wanted to thank you for allowing me to speak before you today. Okay, my name is Marie Virata Halloran. I'm the Executive Director for Rainbows for All Children Guam and LifeWorks Guam. Okay, I am here today to speak with you about House Bill number 254, which accurately states the qualification of a certified school counselor, their distinct scope of work, and defined roles in providing assistance to all students in the Guam public school system. I am entirely in support of the bill 254-36 because this bill serves the best interest of all students attending GDOE. As a retired school health counselor and organizations that I represent, I recognize how students and parents rely with confidence and trust on the services provided by GDOE. The school counselors play a strong, interactive, and proactive role in the lives of our students now and indirectly influence their future lives. We cannot and must not shortchange the value of the services provided by the school counselors. If we did, there would be a detrimental impact on the students' optimal health, well-being, and becoming future leaders of tomorrow. School counselors are asked to assume duties that are inappropriate, okay? 3 of which I will mention: providing long-term therapy, evaluating level of risk for suicide, assessing and screening mental health disorders of students. Okay, in my training, and I have had a lot of trainings, and I've been doing suicide prevention for the past, I think, 27 years. And I believe that once a student presents that they are thinking of harming themselves or showing like inaction or things of that nature, it should always be considered a high risk. So I'm not very sure what they're asking them to do, like level of assisting, level of risk. It's always a high risk. I want to emphasize that because we do not like students to be, later on we'll hear very, very sad situation of our students. Okay, and these tasks are not congruent with their ethical standards as clearly defined in the American School Counselors Association ethical bylaws and standard procedure, of which the Guam Association of School Counselors are charter members, which is actually being a charter member is a big deal for Guam, because out of all the territories, Guam is the only one that is credentialed and part of ASCA. Okay, students should be referred to a licensed practitioner, such as a psychiatrist or psychologist, or other resources like the Guam Behavioral. Okay, I am in support of having a qualified school counselor coordinator. Remember, like as I said, it has to be a qualified and certified school counselor coordinator. This person must be, again, certified counselor, deliver excellent leadership skills in implementing a comprehensive school counseling program, direct widely, must be able to work well with each school counselor, coordinate and support all the school counselors in every school. They have to be in the same pace, and they have, whoever would be the coordinator has to know exactly what the job of a school counselor is. School counselors, to me, they're very, very important. And just like what the mother shared, the parent, what had happened. Maybe, you know, like she said, school counselors are detailed in so many other positions except for what they need to do. So that is my take. I fully support the bill. Thank you.
Thank you, Ms. Holleran. I'll now like to call on Ann Corcoran. Did I say that right? Ann Corcoran. Okay, let's see her here. Deborah Mariano. Deborah Mariano. Is Deborah Mariano here? Okay, no. At this time, I'd like to acknowledge Senator Shelton. Thank you for joining us. I know you joined us a while back. My apologies for not acknowledging you sooner. Okay. Diana Edwards. Diana Edwards. Is there Diana Edwards?
Hi, Senator, I'm here.
Okay.
I don't have any prepared written testimony, but you know what, I think I'm just going to speak from the heart, if that's okay. One of my big concerns, and the reason I support this bill, has to do with the mental health screeners. So, you know, I have been in communication with Dr. Carolyn Stone. She is the ASCA, American School Counselor Association Ethics Chair. I don't know how to say it. In a nutshell, she said that when school counselors do, for example, the Columbia Severity Suicide Rating, students can basically tell them anything just to escape from being under the microscope. So our current SPAM has us quantifying suicide using that assessment. After you do the assessment, the student comes out either low, moderate, or high. According to our SPAM, if the student is low, they get school counseling. If they're moderate, they get 3 sessions of school counseling. And then if they're high, they get referred to, you know, an outside agency or another resource. To me, I just think that that is actually putting the student more at risk. First of all, you know, the student could say anything at that point. We need someone who is qualified, for example, a psychologist, a psychiatrist, or, you know, one of our other agencies, someone who is actually qualified to assess that student to do. And if you look at a lot of these screeners, they say in the directions that you should never negate risk and that further evaluation is needed. So after you do an assessment, you actually are expected to refer the student, whether they're low, medium, or high, to someone who's qualified to do a full assessment. by having school counselors, I understand that we need the bodies, that we're short people. Guam Behavioral, we appreciate everything you guys do. EFAM, we love you guys. We know you have, you're short on counselors. We get it. However, I have serious concerns about just having school counselors do some sort of an assessment and then leave it at the school level where you see a school counselor who's not certified to do any type of therapy or even accurately assess a student for suicide. It's left at that level. So this is part of the reason I'm really in support of the bill. Dr. Stone in the end said that these assessments are not worth the paper they're written on. I jokingly asked a friend if I could play a recording, because I actually have her saying that on my phone as a recording. I just think that more needs to be done. School counselors, we do take care of our students in that way. If a student comes to us and expresses any sort of ideation, we are absolutely going to call the parents, inform the guardian or parent or whoever is needed immediately. We need to know that our students are going to be safe. And then we're going to refer them immediately to the appropriate resources that can help them, rather than leave it at the school level with a school counselor, where despite whatever the assessment says, if they come out low, what if the student is lying, right, in that moment? What if they just don't want to be in your office, which happens? We know that kids sometimes don't tell the truth. So with respect, I know we are all here just to help the kids. So I'm asking senators, please consider voting favorably on the bill later. Thank you.
Thank you, Mrs. Edwards. Ms. Mariano, Deborah Mariano, are you back? No? Okay.
Sorry, I messaged you that I privately that I needed to use the restroom really quick. Sorry. Okay.
You may proceed with your testimony.
And so along the lines with everyone else in support of the bill, as well as what Ms. Diana Edwards mentioned, I know we're all overwhelmed. There's 80 some school counselors at Agata and 5 counselors at Ifamagonta. However, I just need to state that point, that's also the reason why we have a school-based behavioral team. We have a total of 4 district psychologists at the Department of Education, along with interns. And so, gosh, there it is. There is where we can refer our kids to if we don't refer them directly to Guam Behavioral Health. That's what that team is for. Okay. Hafa and good evening, everyone. My name is Deborah Mariano, school counselor at Agata.
Forgive me, Ms. Mariano. Can you repeat that again? I missed that. What is the team that is available for? Who is this team?
The school-based behavioral health team, the district psychologists, along with they do have interns down at Student Support Services Division. At one point earlier in my career, counselors were referring, and as a matter of fact, Agata was very guilty of referring suicide ideations constantly to the Guam Behavioral Health. And that's mainly because we didn't have an SOP in place for suicides. And so we did not want to negate the risk. We did not want to be responsible. Of course, we all want to be responsible, but what we're saying is, as school counselors, we referred them out to Guam Behavioral Health because there was nothing in place at the time. And I want to thank Student Support Office and the district psychologists for their hard work, for implementing some SOPs and giving us those guidelines so that we're not constantly referring to Guam Behavioral Health, and that we do have a team, like I said, of 4 district psychologists down at GDOE. I think we have more district psychologists than Guam Behavioral Health now. And if we're going to hire more every year, gosh, we have mental health right in our hands at Guam Department of Education. Hafa day and good evening, everyone. My name is Deborah Mariano, school counselor at Agata I. Johnson Middle School for the past 20 years, and I support Bill 254-36. Prior to being a school counselor, I was a teacher for 5 years with all my service years within GDOE. My parents, Francisco and Mary, as well as my 4 children, Shayana, Lester, Marisha, and Dariah, are all products of our public school system. My mom and my eldest girl are former GDO teachers, and I have many educators within my family, leading all the way back to my great-grandparents. The reason why I mentioned this today or this evening is not for political sway or popularity. I want you to all understand that I am vested, as well as my school counselor colleagues. I am family, and I am a proud GDOE employee. Despite all the extreme challenges we've all faced within GDOE, as Guam frontliners, despite coronavirus, despite going through intimidation and being told that I'm part of some clique, my school counselor colleagues being intimidated or threatened if they support this bill or testify, being told I need to follow the chain of command, that I personally attack people, all because I've been outspoken about the lack of resources and standard operating procedures that school counselors have been made to follow, despite some of them being against Guam laws and our ethics. I've basically been asking for GDOE to allow us the opportunity to be effective school counselors for all school children of Guam. I've pleaded over and over again for them to listen to us. We are drowning in inappropriate school counseling duties, and it just keeps coming. I, along with other school counselors, have followed the chain of command, and we are still today, after more than 5 years, still trying to get a proper school counselor job description and evaluation completed. Despite the work by whoever has been working on that for the past few years, we have no school counselor job description down at our human resource office. The board contract really does not stipulate, if you read it carefully, the school counselor job description. And many of our administrators in the Department of Education do not follow the board union contract. I plan to provide a timeline of events and documented requests for many, many years of school counselors and my request for support with our upper management, which I will gladly provide upon request. After this hearing, I hope GDOE doesn't make us 12-month employees instead of 9 months currently out of retaliation, as I and many of my school counselor colleagues have been told whenever we speak against some of their wills. Please pray for us and wish us all the good luck in this world. I am humbly asking for your support for this bill. Thank you all for your valuable time. I do have 2 other school counselors' testimonies that they asked me to read, and I believe they informed you of it, Senator.
I'm sure they informed someone from our team, so go ahead and please read it.
Good evening. First and foremost, thank you for Bill 254-36. My name is Ann Corcoran, and I am declaring my support for Bill 254-36. I am both a certified teacher and school counselor. I've been a teacher for 5 years and a school counselor for 3 school years in Guam. The nationally recognized organization, American School Counselor Association, ASCA, recommends a student to counselor ratio of 250 students to 1 counselor. In my 3 years as a school counselor, I have had to service a student population averaging between 650 to 800 each school year, which is well above the ASCA recommendation. I have seen and personally experienced the setbacks and challenges of providing a sound, comprehensive school counseling program when the amount of duties becomes overwhelming or when duties not pertinent to school counseling are performed. I believe Bill 254-36 is a step in promoting, as well as adherence to, ethical, recommended, and best practices to ensure counseling services to students are appropriate and effective. At the end of it all, despite the difference of views there are, I think we need to do what we can to provide what's best for the students of Guam. Thank you. And the last testimony that I was asked to read, I have asked Deborah Mariano to read the statement on my behalf. My name is Andrea Santos, and I am a middle school counselor at FB Leon Guerrero Middle School. This is my 5th year as a school counselor, but I'm also a family therapist intern, and in my 6th year as an adjunct professor of psychology at the University of Guam. Our children's mental and emotional well-being is inextricably tied to their academic success. The research is abundant and clear in this matter. I imagine that we are all interested and committed to student learning as an end in itself, but also because the students in our schools today will be the stewards of our island's political, economic, social, environmental, and cultural future. They will be literally and figuratively taking care of us, and I want them to do a good job. I also feel certain, as I know each of you care deeply about families, that we want our children to experience and know joy. So, what are we to do as an island community when we read that just this past Thursday, the Centers for Disease Control and Prevention issued a warning of an accelerated mental health crisis among adolescents, with more than 4 in 10 teens reporting they feel persistently sad or hopeless, and 1 in 5 saying they have contemplated suicide? How do we heed this call, this cry for help? The report from the CDC also offers hope in their findings that teens who feel connected at school report much lower rates of poor health. This finding calls attention to the critical role schools can play in a student's mental health, and I would extrapolate from this study the dire role school counselors can play in fostering these connections. Please do not be mesmerized by this idea of inappropriate duties as a ploy to get out of doing things. We are not asking to do less. We are asking for the opportunity to do more where it matters, and caring for, tending to, and working to reinvigorate hope within the hearts of our island's youth is where it matters. This is what school counselors do. It is why the school counselors who toiled writing this bill alongside Senator Nelson did so, and it is why I support the bill. Thank you.
Thank you, Ms. Mariano. Can you just restate the name of the individual whose testimony you just read?
Ms. Andrea Santos.
Ms. Andrea Santos, okay.
FBLG school counselor.
Okay, thank you.
Thank you. Thank you, everyone.
I would now like to call Dr. Asher D. Rossetti for testimony.
Hi, good evening.
Good evening.
Hi, so I am just merely talking not so much about the bill, but just some of the language and how it was written. My name is Asher D. Rossetti. I'm the principal of JP Torres Success Academy. I wholeheartedly agree that students need the support of school counselors to provide guidance and teach them the skills they need to help navigate the complex decisions ahead of them. I also acknowledge that school counseling programs are essential for students to achieve personal growth. They need to acquire positive social skills, values, set career goals, and realize their full academic potential so that they can become productive and contributing members of our island community. I believe the high school is the final transition into adulthood and the world of work. So what we do for our students at this stage is so important. And as leaders, the students we serve, they're still deciding their futures. They're faced with many challenges, including peer pressure, bullying, as we heard earlier, suicidal ideations. There's so much happening for them, including the challenges of college, scholarships, financial aid, entrance into the competitive job market, and in addition to that, family obligations. So our counselors are absolutely essential. While I'm sure the intent of Bill 254-36 is to define the educational and professional requirements for certified school counselors, it also outlines what is deemed appropriate and inappropriate duties using broad and generalized language, which may potentially limit the collaboration and innovative programs designed to meet the diverse needs of students. As the principal of JP Torres, I have a unique population of students, which requires an absolutely dynamic and flexible school counselor. In fact, I spoke with my counselor today, and Ms. Sagan shared that her current duties and responsibilities at JP Torres, they differ significantly from her duties when we were JP Torres Alternative School just a few years ago, and even more so in her earlier assignment in an elementary and a middle school. Based on the list in the bill, my counselor felt 8 out of the 15 responsibilities deemed inappropriate were things that she deemed necessary for her to perform in order to effectively meet the population of the students she serves. Will that be the same for all counselors? Absolutely not. But that's exactly my point. There's no one size fits all, and this bill attempts to do that. The appropriate and inappropriate duties, first of all, those words are so strong. It's so broad that one can generalize them to mean just about anything. For example, it is inappropriate to maintain student records, but shouldn't a counselor maintain confidential student records documenting sessions and services provided? Maybe what we're trying to say is they shouldn't manage the student cumulative folders for their full year. Academic advisement in a high school setting is critical to ensure students are successfully placed based on their interests and their graduation requirements. This includes verifying credits and ensuring students are scheduled for the courses they need to graduate and make informed choices of the courses related to their future goals and life after high school. Bill 25436 indicates student scheduling is inappropriate. While I'm not saying they need to build a master schedule, but the students need to know what courses they need to graduate. There are duties that are inappropriate for school counselors, but is that not the same for all professions? As a school principal, I am primarily responsible for the operations and the academic performance of the school, and I oversee teachers and staff to ensure our students are receiving a quality education in a safe and disciplined environment. With that being said, will a bill listing appropriate and inappropriate duties for principals soon follow? What about teachers, librarians, nurses? There are all kinds of other related duties in all jobs. And in my case, typhoon shelter manager is probably my least favorite. But when there's a need on our island and in our community, I make it work, especially because there's no bill that says it's an inappropriate duty for a school administrator. My primary duties consume most of my time, but there are times when other related duties are necessary. Every presentation and everyone that speaks about the ASCA model and their principles, it's referenced and it guides the bill, but the bill never mentions ASCA by name. So are we legislating and adopting the ASCA model without using that term and that language? Because then the concern is if it's locally legislated, what types of federal programs will be allowed to support this? And so it's supplementing rather than supplanting. Have we considered other models and other professional organizations as well? With Bill 254-36, even if a counselor voluntarily performed duties deemed inappropriate as additional duties, it would be considered unethical or possibly even illegal to help meet the mission and vision of a school by scheduling students, by maintaining records, by scheduling academic testing. So rather than opening Pandora's box by outlining appropriate and inappropriate duties, one might simply consider identifying primary duties and potential secondary duties where counselors can serve in leadership capacities to do things and service to the school for committees as outlined in the collective bargaining agreement so that all school employees continue to work collaboratively to meet the needs of the students we serve. So thank you for allowing me to share. As I said earlier, I understand that our counselors work so hard and I'll never take that away from any of them. And they'd like to maybe streamline what they're required to do. But listing things that are appropriate and inappropriate opens a door for all professions. Thank you for allowing me to share.
Thank you, Dr. Rossetti. We appreciate your input and feedback. Okay, the next person we have is Mrs. Stella Collada. Stella?
Good evening, Senator Nelson. Thank you so much for allowing us to share today and then for allowing us to give our reflection. I am Stella Calata, Benes Jan Hafaday, Honorable Senators of the 36th Guam Legislature, for administrators, and to all the fellow school counselors and even teachers who are here at this time. This reading of our testimony is from me. I'm a school counselor in elementary level, Stella Calata, and Nadine Cruz, also the school counselor at GW, Guam High School. George Washington High School. And we are writing you today to express our full support of Bill 254-36. The bill is an act to add a new chapter to Division 2 of Title 17 Guam Code, annotated. It's not a standalone bill. It's relative to defining the educational and professional requirements for certified school counselors and to authorize the compiler of laws to make changes. This bill is very important to us for the following reasons: to support school counselors to help all students apply academic achievement strategies, manage emotion and apply interpersonal skills, and plan for post-secondary options, higher education, military, workforce, and even their own career growth. Number two, to implement a comprehensive school counseling program that includes service delivery systems to promote wellness, resiliency, skill building, and self-advocacy skills. School counselors implement an appropriate SEL curriculum to address students' social, emotional development and wellness. This will allow school counselors to improve the delivery and integration of school-wide programming, to foster a positive school climate, prevent violence, and balance physical and psychological safety. A lot of counselors go out of their way to attend professional development off island or virtually, out of their money, their personal money, out of our pocket to really attend those sessions to be able to help our students with regards to their SEL growth at this pandemic time, especially. Number three, to define the qualification, scope of practice, ethics, and standards of the school counseling profession at the elementary, middle, and high school levels. Professional school counselors are advocates, leaders, collaborators, and consultants who create opportunities for equity in access and success in educational opportunities by connecting their programs to the mission of schools and subscribing to the tenets of professional responsibility. I am an elementary school counselor, and I try to do this in collaboration with my administrator, with all the different teachers and instructional support, and even the teachers who volunteer to be rainbows facilitators, to be peer mediation coordinators, to help our students really feel at home in the school, especially during this pandemic time, to facilitate Wednesday classes online or in person, or Mindful Monday, to come up with those sessions for all our students in elementary level, because I'm speaking for my experience, and I'm sure middle school and high school counselors would also love to do that if they're given the opportunity to really focus on appropriate school counseling program model. Number four, to identify the role of a school counseling director, coordinator. The SC director coordinator provides leadership, advocacy, and collaboration at the school, district, and state levels to ensure the development, implementation, and assessment of a comprehensive school counseling program that benefits all students. We want a master counselor credential for our leader as a school counseling director or coordinator that is provided by public law, which is actually credentialed by GCEC. Number five, to prevent school counselors from being tasked with inappropriate duties that may lead to litigation and violation of the Protection of Pupil Rights Act and Family Educational Rights and Privacy Act, FERPA laws, where we don't want SEs to be tasked to use clinical mental health screeners and conduct long-term counseling for psychological disorders. That's not within our lane of school counseling. And I have personally asked a person in the States, a licensed individual practitioner, uses the Columban assessment to really check out if a student or a youth needs to be given that kind of an intervention. Number six, to advocate for appropriate training and resources so that school counselors can facilitate the growth and development of students to reach higher goals. Higher goals would be career, college degree in the future, to really help out in the community. This is for the future of the generation of the youth of Guam. This bill will help our students in the long run. If we continue to serve as school counselors, where we are given the task of doing the district-wide assessments like I have done this week, our school is the first to have the district-wide assessment. I feel hurt when I cannot counsel the kids because I need to do my DWA protocols, 21,750 tickets, test tickets for the kids. I'm just so grateful that my team in my school are there to help out. Can you just imagine me doing 40 hours of work just for preparation? We don't complain. This is my 20th year to be doing that. And I'd like to just share how I need to still counsel kids who are depressed or anxious, or kids whose parent committed or completed suicide last month. But I am torn between doing DWA and doing that job. So I am just so grateful that my administrator is helping me in this regard. But then it would, can you multiply that by 41 schools? And I'm very empathetic about this because I feel it. It hurts so much if this bill will not pass. But then again, we say, whatever will happen, will happen. We will still continue to do our job. Thank you for your time and attention. To our parents, I have actually canceled 2 parents' workshops just to do this inappropriate job that I have for district-wide assessment. I am a team player, so I don't complain. We do continue to help out, but we would really help. It would really help us be supported in this journey. We would sincerely appreciate your support of this bill to ensure that the educational community and stakeholders are aware of the hard work and dedication of school counselors in the implementation of a comprehensive school counseling program based on the National Association of School Counselors program model. This bill is very important and we support this. I am Stella Calata, Guam Association of School Counselors GAS President, and Nadine Cruz, GAS Executive Vice President, School Counselor of GWHS. And together we have 45 years of experience as school counselors. Thank you so much and good evening.
Thank you very much, Ms. Collada. And we'll now move on to Dr. Tony Cruz.
Good day. Thank you very much for giving me an opportunity to speak. Thank you, Senator Nelson, Senator Shelton, Senator Brown, Senator Taitigui, and Senator Ada, who's present, and any other senators who are, I did not mention at this time. I would like to provide my verbal testimony to you. My name is Dr. Tony Cruz, and I am a psychologist on Guam. I am also a parent of 2 young boys. I am a licensed professional counselor and a licensed mental health counselor here in Guam. I am present to provide a written and oral testimony to oppose Bill number 254-36. I am strongly opposing this bill because this bill is not student-driven and it puts GDOE students' lives in danger. I oppose this bill because it limits the school counselors' roles to support our students. Senators, I would like to ask you this question, and I would like you to think about it before you answer it to yourself. I would like you to think about your sons, your daughters, your nieces, your nephews. If they have a single thought or even a recurrent thought of active or passive suicide, would you like your child, or your children, your family members attending any school district to be screened for any mental health challenges? Would you like them to see their school counselor as soon as possible, and for your child, your family member, to be screened for suicide? And if your family member, your child, is at risk for suicide, you would want them to get help as soon as possible. School counselors are heroes because they are the first responders when students experience social and emotional challenges at school. When a school counselor learns a student feels he or she does not want to live, the school counselor conducts a suicide risk assessment. This is the questionnaire in order to screen the risk for suicidality. The school counselor will ask the student structured questions regarding the duration, frequency of his or her suicide thoughts. A school counselor will be able to identify student risk factors such as feeling hopelessness, helplessness, feeling scared, frustrated emotions, substance use, and so on. So the school counselor will also help the student learn what are the student's protective factors, such as identify the reasons for living, who are the social, family, friends support, what are the students' belief and spirituality system that will save them from hurting themselves. So the school counselor will help students develop a safety plan and make contact with a school psychologist for further guidance, contact the student's legal guardian, and make referrals to outside agencies for future treatment. All these process helps to save lives of students. Without a suicide risk assessment, students will continue to become a danger to themselves. However, according to this bill, 254-36, assessing level of risk of suicide and assessing and screening mental health disorders are considered inappropriate duties and activities for school counselors. Now, most GDOE school counselors have participated in numerous professional development trainings that address the Columbia Risk Assessment, which is a screener which screens the level of risk for suicide, applied suicide interventions, safety talk, postventions, youth mental health first aid, mental health screeners. And just to add here, there's a public law, Public Law 202-31. It allows school counselors to conduct mental health screeners. It is a public law, and school counselors has been trained in multiple times to administer and score mental health screeners. So this is not new. They have the education for this. And ASCA does not prohibit school counselors from doing mental health screeners. So most GDOE school counselors have a master's degree in counseling. Some have a doctorate degree. So if you could look into yourself and kind of intellectualize a master's of arts in counseling. So when you have a master's degree in counseling, you have a professional education to help save lives of students. In addition to a master's in counseling and numerous professional development trainings, GDOE counselors receive consultation from licensed professional counselors, licensed mental health counselors for guidance in order to continue school level interventions, referral to SBH, referrals to outside agencies. Senators, this is one essential reason we have to oppose Bill 254-36, because it takes away the school counselor's role to save GDOE student lives from suicide. Let me give you a reality. If this bill passes, and senators, if you sign this, if you pass this bill into law, this is a bold statement, but it's a real. You will see students harm themselves. You will see students kill themselves, and their bloods will be on your hands. In addition, for another reasons why I'm opposing this bill, senators, Bill 254-36 allows elementary school counselors, states that elementary school counselors are uniquely trained in child development. Yet this bill will not provide school counseling services to pre-K and Head Start program population at GDOE. These students are part of GDOE systems and they are entitled to have school counseling services. This bill will not provide them school counseling services. I have another question for you, senators. Do you think all students are the same? That would be very simple for us to think about, but in reality, they're not the same. School counselors are hardworking professionals who help students with social and emotional challenges. Most school counselors start out as teachers in the classroom, most of them. They enroll into a Master's of Arts program in counseling in order to become professional school counselors. Within their master's program, school counselors learn different theoretical orientations for counseling interventions, such as client-centered, behavioral counseling, cognitive behavioral, brief solution focus, right? So they learn all these theoretical orientations. This bill allows them only to practice one type of counseling, which is brief solution focus. According to this bill, individual counseling sessions are brief and solution focused. Now, school counselors know that brief and solution-focused counseling does not work for the entire diverse GDOE population. School counselors do not provide long-term therapeutic counseling sessions. They do provide up to 8 to 10 sessions. However, school counselors are aware that it takes time to develop rapport building with their students, as some students need time to open up. However, Bill 254-36 prohibits school counselors from developing rapport with our students in need of school counseling services. In fact, this bill states the number of sessions may be between 3 to 5 sessions, lasting no more than 30 minutes in length. This limits the opportunity for students to spend time with their school counselors and receive services. So school counselors are aware that all students do not fit a one-size-fits-all concept. School counselors are aware they are able to still provide school-level interventions using different counseling methods other than just brief solution-focused interventions, and may go beyond 5 sessions. Just because a school counselor sees a student beyond 5 sessions does not mean they are providing therapy. It doesn't mean they are providing long-term counseling. It means school counselors are doing their job correctly. School counselors are hard workers, but Bill 254-36 prevents them from helping students who do not fit the one-size-fits-all. So senators, this is another reason why I am opposing this bill, and I'm asking you to oppose this bill. Another aspect that I am opposing this bill is because there's no mention of any virtual school counseling. During the pandemic, school counselors were heroes to our students. They provide virtual school counseling in order to help our students who they don't see face to face. I'm so proud of them because they develop calming rooms, virtual calming rooms, and they updated their resource rooms so that students and parents will have an opportunity to get resources out from their websites. This bill will not allow school counselors to do virtual counseling. Finally, senators, I would like to bring this to your attention. As I searched the resources for this bill, 254-36, senators, I don't know how to write a bill, nor have I ever written one. I did write a doctoral dissertation, though, and I learned that writing a document has to be original, your own work, your own thoughts, your own writing. It appears most, or maybe all of the content of this bill from page 1 to page 20 are unoriginal and directly copied and pasted word for word from different sources from the internet. I have printed out sources from the internet. I went and I did my research, and I have 2 sons. Last summer, I had made them. I instructed them to write essays every day, in order to teach them that you need to own your essays. You cannot plagiarize. All right. So this bill is directly copied from the American School Counseling Association website and from KCRIP website, and there's no mention or giving credit to the American Counseling Association and to KCRIP. So I'm not sure what school counselors or who are the school counselors who contribute to formulating this document, because it's not written. It's a formulation of different sources out there in the internet putting together to be claimed as a bill. All right. And so I would encourage that you probe all who contribute to developing Bill 254-36 and be mindful of the unoriginal work before you sign your name on it. This is very, very important. I don't know any ethical guidelines or what that will violate this one, or any law, but that's not up to me to decide. Finally, senators, this is my last point here. Thank you for giving me the opportunity today to address my oral testimony. Senators, I hope your decision on this bill is not based on how many people showed up to support this bill and how many did not show up to oppose this bill. Senator Nelson, please understand that Bill 254-36 is not a way to resolve the SOP for the Standard Procedural Assessment Manual, emphasizing suicide risk assessment of students and some school counselors' dissatisfaction with their roles. Senator Nelson, in order to resolve these matters, please repeal Public Law 202-31, Article 7, mental health screening, in order to modify the 45-day period. That is going to resolve this situation. And please allow us, other stakeholders, to provide input to help you out, not just the school counselors. Thank you very much. Thank you for this opportunity.
Dr. Cruz, I just want to state that you're absolutely right. The model here follows the Association School Counselors Act. So you're absolutely right. This is what the job the school counselors are supposed to be doing. And this is the focus. The concern with the suicidal ideation is that there was this document in the SOP that showed that you have to determine a level of risk, like whether the student is a low risk for suicidal tendencies, medium risk, or high risk. The argument here is that if you want to commit suicide, or someone tells you that they're going to commit suicide, they want to refer them to a person that is more qualified than a school counselor, because the suicidal ideation does not just happen that day. It probably has been affecting the child for years. And so it is a severe mental health issue and not something that should be rated. And I think that's what the counselors are concerned about, is that there's that risk there, that if they rate it as low and something happens to the child, that they're going to be held accountable because they're not fully trained, nor do they have the time to sit with the child continuously on a day-to-day basis or 4 times a week and give the child the services that they need, especially when they're seeing over 400 students. So thank you for that. I'm telling you what the school counselors are telling me. I'm not going to get into a debate with you right now, Dr. Cruz, but I do appreciate your input. And we have reached out to GDOE to fix that 45-day law. We have not heard back from them, but now that you are here, I'm glad, because we are going to work together to see what we can do to amend that.
Thank you so much.
Thank you. I appreciate your input. Okay, we are now going to call on Gianalyn Egarola.
Thank you, Senator. That's me. I just wanted to make sure you're able to hear me.
Yes, I can hear you. Thank you.
I did mention I apologize for being on my phone. My connection at home is cut based on GTA, and so I appreciate you putting me on. And I would like to just go ahead and read my testimony. And I'd like to start off by just thanking you so much for your time, you and the other senators, for taking the time to listen to all our testimony, both for and against it, because I believe that it gives you a big perspective of how important, really what we're hearing is how important this bill is. And I respectfully request your support and vote in favor of this bill, which is now known as the School Counselor Bill. I want to just let you know I had the honor of being employed as a school counselor with the Guam Department of Education for 14 years, and I absolutely love what I do as a counselor at Jose Rios Middle School. With the guidance and support of your office, the bill was written by school counselors for school counselors to best serve our students. My personal support of this bill, I want to focus on, is my personal support of this bill is its intent. Its intent to guide decision makers of school counselors in the areas of developing relevant policies and professional development, as well as to support a comprehensive school counseling programs in our school. Not just focused on interventions, but a comprehensive program, which includes prevention practices. Contrary to popular belief that we should primarily provide therapeutic services and schedule students all day, this bill clarifies that SCs are also educators. We are educators that support our students to be better learners, to be positive peer influencers, and to be goal-oriented decision makers. All these goals are in line with GDOE's vision for our students to be responsible, respectful, and ready for life. All we ask is that we do our job because we do serve the majority of the students. Our role is to serve all students and not just the tier 3 students that require a lot of specialty services that we definitely support and are trained to refer when appropriate. We do not dismiss these students. We deal with them when they are in front of us. But our job is also to make sure they receive the support outside of the school which is why we refer to our community stakeholders, as well as refer to our district psychologists, who will be able to follow them throughout their years at GDOE. I'd like to thank everybody, and I support all those in support of the bill, and I appreciate all the different perspectives. But I would like to close by saying I humbly ask you to support this bill. It's not for the benefit of school counselors. It is to support the career and academic development, and most importantly, especially now, the social emotional wellness of all our students on the island. Thank you. Thank you for your time.
Thank you, Ms. Agurola. I would like to call on now Mr. Kenneth Paris. Kenneth Paris. Okay. Gina De Guzman. Gina De Guzman. Lessa Ramos.
Good evening, Senator Nelson, and all the senators who are with us today, all our admins and my fellow colleagues. Thank you very much for giving us this time, giving us your very important time to listen to us counselors. I would just read the written testimony from our school, from our team of counselors from Simon Sanchez High School. We, the school counselors of Simon A. Sanchez High School, give our heartfelt and full support of this bill. We believe that the work that we do is valuable in providing our students with the support that they need in order to be successful members of our community, and as such, the bill acknowledges our value. The language in the bill mirrors the ASCA domains for school counselors that indicate student success through academic, career, social, and emotional development. This bill provides us with a framework to follow that is related and relevant to duties and responsibilities of school counselors. We can, sorry, I'm very nervous. Please bear with me. This bill empowers us school counselors to improve our professions by having a leader in the district who can advocate for us and our programs. It will also allow us to focus on our counseling programs and serve the needs of our students without having to do unrelated duties that were being assigned to us. We can no longer afford to have district management make the decisions about what we do without our input, and at one point in history, deemed school counselors as non-essential and reduced our hours to a 32-hour work week. As high school counselors, much of our activities vary from day to day as we help our students navigate the complexities of their teenage years. We are trained professionals who complement the school's education team, and we need meaningful time with our students. If Bill number 254-36 is passed, school counselors can focus on fully implementing programs that encourage high school completion, especially for our high-risk students who may have interfering factors that get in the way of their education. With a high school diploma and increased educational attainment, as they transition to young adults, they have opportunities to earn a higher income and gain access to better living conditions that impact our island's overall health and socioeconomics. Bill number 254-36 will allow the school counselors to thoroughly focus on preparing the students for their career and post-secondary options. The comprehensive school counseling programs will give the students in high school the opportunity to explore their interests, various career options, and post-secondary plans, as well as have a successful transition to employment and post-secondary education. Thank you very much. That's from the team of Simon Sanchez School Counselors. Good evening.
Thank you, Blessa. We appreciate your testimony and the counselors at Simon Sanchez that you represent. Okay, let's move on to the next person on the list is, forgive me if I say this incorrectly, Libonos Irene Aguilar. Libonos Irene Aguilar. Okay. Lynette Kitagwa. Lynette Kitagwa. Okay. Michael Meno. Michael Meno. Timothy Fidenko.
Yes, Senator, I'm
Fidenko.
here.
Hi, would you like to give testimony?
Sure, I'd just like to make a few comments since GFT was brought up in a lot of this.
Thank you.
Thank you, senators, for the time. And thank you, counselors, for taking this action, even with the grievance process. I almost feel like I should apologize that we couldn't do more. It was nice to see Leilani, former negotiating Professor Guerrero, now I think it would be proper. She sat at the table. It was even more strange to see James Petit sat across the table. And as you know, when we negotiate humbly and begging because the union doesn't have an ability to take action in the form of protesting and striking. So it is a weakness. Maybe, as Dr. Rossetti said, the legislation, this will be the future. Maybe you should define class sizes for every school teacher and make it a law. Maybe this is the future at the detriment of possibly the union. I say this as president. I hope not. But I think hearing both sides with Dr. Cruz's points and the Senate, the counselors' points, they've come to a point where they're so frustrated by not getting their voices heard and listened to that they've formed this great committee and they've sought help from you senators. And I'm hoping you're listening to them. I think the ratio is ridiculous. I hear 250 students, which was in the contract, but once again, little teeth in the contract. What can we do to stop this? We don't have a vote on the school board. I've mentioned it to the school board. Mental health is such an issue. It's a key topic. These counselors and everyone speaking tonight is concerned, truly, I believe, for it or against it in the mental health of our students. That I believe. And I think if people get together and discuss things and formulate what they need to do, you can have that, right? Mental health wellness said they're short people. It's systemic across the board. Maybe the Department of Education didn't put in those positions. I don't know. Maybe they didn't have the budget to pay for those positions. There's a lot of finger pointing that could go on. But the important thing is here that everyone gets together and talks about it and discusses what's going on. And we need that so much. And these counselors are the hardest working counselors I've seen. I do know this as a school teacher in a school of 650, one counselor who is not a certified teacher is a certified counselor, should not be substituting in the classroom. There should be substitutes for that. It should be bar none. ACT Aspire testing, that's clerical work. It should not be done by a high-paid counselor. That's ridiculous. It's almost moronic. So I don't know if it's management that can't handle this or what. So probably to the detriment of the union, I do support this bill. And I thank you for your time. It's been a long night. Good night, everyone.
Thank you, Mr. Fidenko, for your testimony. Ms. Rose Castro? Ms. Rose Castro? Okay, I think everyone's just listening in. Leilani, did you have something you wanted to say?
I actually had another testimony from another counselor who asked me to read to her or for her.
Can you state the name for the record?
Samantha Revo Cruz.
Samantha Revo Cruz. Okay, thank you.
Buenas and Hafa a day, Senator Nelson. My name is Samantha Revo Cruz, and I am the 8th grade school counselor at Estimbo Middle School in the Guam Department of Education and the incoming treasurer of the Guam Association of School Counselors, also known as the GASC. Please accept this written testimony in support of Bill 254-36, an act to add a new chapter to Division 2 of Title 17 Guam Code Annotated, relative to defining the educational and professional requirements for certified school counselors, and to authorize the compiler of laws to make changes. As a school counselor, I seek to advocate, educate, and meet the individual needs of my students and the community in which I serve. More often than not, I come across many people who are unsure or unaware of what school counselors do, the services we provide, the role and our programs serve within our school system, and its necessity in meeting our students' needs and accomplishing the mission and goals set forth by the district, most especially how a comprehensive school counseling program, when implemented effectively and with fidelity, can directly and positively impact all aspects of our students' lives and overall student achievement. Bill 25436 defines and outlines what a professional school counselor is, the requirements needed to practice, the appropriate and inappropriate duties and responsibilities with which school counselors should and should not be tasked, and how comprehensive school counseling programs should be driven by data and determined as effective or otherwise in need of improvement based on the student needs as stipulated in the competencies and professional standards of the American School Counselor Association. In seeking to advocate for and educate our students and community, I believe the passing of Bill 25436 serves as an excellent opportunity to educate and promote school counseling programs and services to the public, to acknowledge what school counselors do and the role we serve in meeting all student needs, and ultimately to improve overall student achievement. The bill allows all stakeholders to be well informed of what services and assistance school counselors can and continue to provide to our students and parents at the school level, and allows school counselors to be held accountable in fulfilling our duties and responsibilities with which we are tasked. Bill 25436, if passed, will allow school counselors to do what they were trained to do and provide the necessary services to our students whose care we have been entrusted. Unfortunately, in the current circumstances, school counselors are often tasked with many duties that tend to decrease the amount of time necessary to implement effective school counseling programs and meet individual student needs. While all assigned tasks are imperative to and do play a role in meeting student needs, tasks assigned that are not school counseling related often require school counselors to deviate from completing their mission of preparing our students for life and addressing social, emotional, academic, and career needs. Tasks such as heading the coordination of child study teams, the annual district-wide assessments, Section 504, along with providing coverage for teachers and or vacancies, can significantly hinder the ability of school counselors to perform the basic requirements and fulfill the ultimate function of our role and position within the school. This bill defines the role of the school counselor and stipulates appropriate school counseling responsibilities and duties without leaving room to compromise, providing at minimum the services school counselors were trained to and are responsible for providing to our students. As a result, Bill 256-34 ultimately, I think that the wrong number, Bill 254-36 ultimately advocates for our students to receive the utmost care and quality of professional school counseling services to which they are entitled to and deserve. Amid this COVID-19 pandemic, when the social emotional needs of our students are at the forefront and more services are required to address them now more than ever, Bill 254-36 will afford school counselors the time necessary to meet the various needs of our students, improve their quality of life, and ensure they are college and career ready. In closing, I humbly ask for your support and the support of the Department of Education and our island community leadership, and look forward to the continued collaboration in meeting the needs of our students' youth. Sincerely, Samantha Revo Cruz.
Thank you. Thank you, Lonnie. For that.
You're very welcome. Senator Nelson,
yes.
I know that you have some more people to, there's quite a number. I just wanted to add that you know, I've heard a lot of things in regards to the risk assessments, and being that I teach ethical standards up at the university and school counseling programs, I can tell you from Dr. Carolyn Stone, as well as the American School Counseling Association, verbatim, this bill is coming forth. It wasn't pulled out of the internet. It wasn't randomly put together. We are the Guam Association of School Counselors, an affiliate of the American School Counseling Association, and that's where this verbiage is coming from our association that sets the national standards of how to meet our students as school counselors, not mental health counselors. And I think we have to remember that's the role that we have been tasked to, school counseling, because there's abuse, there's substance abuse, there's drug and alcohol, there's mental health. We are school counselors, and we need to focus on the academic, career, and social needs of our students. Thank you.
Thank you, Lonnie. I'll now call on Mr. Jason Cruz. Jason Lee Cruz. Are you here?
I'm here,
Oh,
Senator.
okay.
Okay,
Can you
turn my
turn on
video
your
on.
camera? Oh, there you are. Okay.
Yes.
Hi.
Hi, Senator Nelson. Yes. Yes, as forgive me for just coming on the spot right now. I'm a high school school counselor from Teason High School, and I've been a counselor, a school counselor for over 10 years already. I'm also a licensed therapist as well. Okay, and letting you know that seeing both backgrounds, working with students but also working with clients. Just as Ms. Leilani is actually speaking, and Ms. Diane Edwards also spoke, as well as you also spoke. The difference between a student who feels very suicidal, can happen at the drop of a hat. Working with students, their emotions run very high, and we are school counselors, but at the same time, we make these judgment calls to actually, intervene because of the fact that we care. Being, an advocate for students for so many years, I've also been a teacher. So, I've been wearing all these different hats. When students are faced with suicidal ideation, their mental state is not there. And like you said, students can be suffering for so many years, or even maybe for a few minutes. But it only takes that one moment for a student to break, and then it's all over. So, as far as mental health screeners, when we talk about things like that, I myself, I don't use those screeners. And I'm giving testimony because of the fact that when I work with students who are suicidal or are saying that they feel suicidal, or sometimes they say, well, sir, I'm only joking around. I do not joke around with things like that. I don't take the chances of saying, well, maybe they're low risk. They're just joking around. Because I'm not going to go home after a day's work performing a mental screener and saying that, well, they're low risk, and then finding out the next day that they're gone. I don't want to live with that kind of guilt for the rest of my life, and I never will. And that's why, the mental health screeners, we shouldn't be doing things like that. It's very serious. Kind of getting emotional right now because I've actually spoken to my brother who's back in the States, and just in reference to what you're talking about. I have a nephew that attends a very prestigious all-boy high school, private high school in Hawaii. One of their brothers, because it's an all-boy school, he's a senior. He's not with them anymore because of suicide. This is a senior who went through this school, freshman, sophomore, junior, senior year, but is no longer there because he committed suicide. Now, hearing that, talking to my nephew and telling him that we're going to be here for him, that's a support that we give to our students no matter what. Screeners are no screeners, but when you're dealing with situations of life and death, consequences that are playing out in the student's head, you do not mess around with things like that, and make a judgment call whether or not they're low risk or high risk. You refer those out because they need help. And sometimes they feel shame for even saying something. But once they reveal that, whether they're joking or not, as advocates for students, we do not mess around with things like that, and we refer those situations out. Because like I said, we care for the students. And that's all I just wanted to add to that. Thank you.
Thank you, Mr. Cruz. Mr. Derek Santos, would you like to give testimony at this time?
Yes, Senator, thank you very much. I know that it's pretty frustrating, especially with everybody giving testimony. I can hear that, again, I'm going to speak on my behalf. I do know that my colleagues are also asking, they're also on this meeting. I am the principal of Inron Middle School, and I got to say, first of all, that my counselors are awesome. They do everything that is needed for our school. So I have nothing to say that they are just true professionals. With that said, I do want to support the counselors in their process of trying to get things done from a higher perspective, obviously. And I do know why they're doing things like this. However, I am not in support of the bill because these kinds of issues can be addressed through the CBA. We have that process in place, and I do know there are issues with the current system of how we can address it and making sure that management is held accountable to that. I do agree, again, that that area needs to be improved on when it comes to this kind of situation, because I am concerned that this will set precedents for other positions in our department or any other department. Every time there's a grievance, I get it. Again, I'm supportive of the counselors, but if there is a grievance and it doesn't, get handled by management immediately, then definitely they're going to seek a bill to make it law. And again, that concerns me because it's going to start setting precedents. So obviously, to all the senators that are here on this meeting tonight, everyone talking about students and children and all this, I agree. We're all in support of kids. We just have our own views about how we should go about. But I do also agree that administrators need to improve our process and be held accountable so that we don't overstep our bounds when counselors are told to do things that are way outside their job. I'm going to speak on my behalf of that. That's my opinion about this whole thing. And I think that we need to, correct those issues in the department level. But once it becomes law, you're talking about a law that's going to hold everyone accountable, even after we're gone, unless it's amended or something like that. We have a process. It's not a perfect process with the CBA up, and we can make sure that Mr. Fedenko, again, is part of this and he's well aware. Obviously, that the GFT is a strong advocate to this whole process, but we want to ensure that every voice is heard. Unfortunately, it came to this route where a bill has to be made so that we can, hear all sides. But I do agree that this needs to be rectified immediately. I just don't agree that it has to be through law. And so again, we have very good counselors. I'll tell you that right now. I see some really good ones here on the panel. And I do want to say that everyone here seems to have the kids' best interests at heart. But if our current process is fixed, better, much improved, then that's, I think, where we can go and get started on that, definitely, because obviously this is where it's at now. But my biggest concern is that this starts to set a precedence for every time there's an issue that doesn't get handled immediately. But again, the ASCA model doesn't say you can't do screening. It doesn't say all that stuff, but it doesn't, again, advocate that it constantly gets done. All I'm saying is that the counselors have a due process here that is valid, but a law is not the process of which we need to incorporate because, again, it sets precedents for everything else, and it's just a slippery slope once this goes down the line. I hope that the senators who are listening in understand that, again, We have an issue with DOE that needs to be rectified. I'm not going to turn a blind eye to that. I'll just tell you that we need to rectify this situation, but at DOE level, and do it immediately, so that the counselors who are here on this panel can understand that we are all working together as one and not divided. Because again, right now I see all these wonderful people here, administrators, counselors, teachers, all saying this or that about what they feel, but we all agree that children are going to be the focal point of our process. So I can say that right now we are not one uniform DOE because of this issue. So yes, it needs to be rectified. And I want to be on the record as saying that it does need to be rectified soon, so that our hardworking counselors can see the fruits of their labor, and also, again, make sure that the kids are at the forefront. I just want everyone to understand that you can't do one without the other. You can't pick and choose which one in the ASCA model you want to follow and whatnot. We just need to make sure that we always keep the kids at the forefront. So fixing our issues at Department of Education is definitely a must. So Senator, thank you very much for listening. It's been a long day. Everyone, thank you again. Keep up the good work, and let's see where we go with this. But thank you again for this time.
Thank you, Principal Santos. You brought up a very good point about the process, and I believe that the grievance was filed. And actually, that is the first thing I asked when, before we had the roundtable and the counselors came to me. I said, well, did you talk to the board? Have you talked to the superintendent? What is GFT doing? And so the issue is that the grievance, there was an agreement that they would correct certain things, but then in the end, the finished product, it didn't reflect what was compromised. And so we are here today, and thank you for your input, because definitely this will allow us to create a more cohesive, a more holistic bill as we move forward. So we appreciate your input.
Thank you.
I'd now like to call on Ms. Vanjie Cepeda. Is there anyone else that would like to speak after Ms. Vanjie Cepeda? So that if not, I can open for questions to my colleagues to ask the representatives of the GASC and GDOE leadership. So if
Thank
you'd like to give I'm sorry, Ms. Cepeda. If you'd like to give testimony, just go ahead and raise your hand on the Zoom chat, and we'll call on you after Ms. Cepeda.
Thank you very much, Senator. It's been a long day. I just wanted to say that this bill, I'm going to say that I too, I want to introduce myself. My name is Evangeline Cepeda. I'm currently the chairwoman of the Guam Academy Charter Schools. I also was an elected board member for the Guam Education Policy Board. And I want to say first and foremost, and I was also a board member with Academy of Our Lady of Guam. So talking in a perspective of that level, I want to say first and foremost that really I like this to remain the power of the superintendent and the Guam Education Board. Okay, that's the first thing I wanted to make in regards to this. And I do understand, I do agree that there should be a process. And I that's the first thing I want to mention. In regards to Bill 254-36, I support the school counselors. Let me tell you, the government of Guam private sector, one thing COVID has taught everyone is to utilize our full resources to its capacity. We don't have all the resources. And I'm speaking in the event that the reason why I'm opposed to this particular bill is for two reasons. And one reason is in regards to the restricting the to 3 to 5 sessions as to oppose up to 10. I'm going to speak and be honest here. I've been through therapy. I, as an adult, chose to go and see therapist because I needed it, clinically depressed. And it took me, a depressed adult, it took me to see a psychiatrist 17 sessions. And I wasn't even suicidal thoughts. So I'm saying that they shouldn't restrict this. They shouldn't restrict this, Senator, into that. That's my argument. Every child is different. Okay, every single child is different. One child it takes forever They can meet for 3 sessions and it's not enough. You can meet a child in 2 sessions and accomplish the goal. So I'm saying that to restrict it to 3 to 5, that I don't feel that. I'm opposing that first and foremost. That's the first thing I want to say in regards to this, that there maybe come to a happy medium, but 3 to 5 is very minimal. And at what cost? This particular, I'm not a counselor, and I'm not going to stand here. All the professionals are part of on this list here. I'm talking from a perspective of a mother, a single parent who raised her 2 children in the public school system and put them in the private school. So, and my kids had counseling. And I'm going to tell you, the school failed. The school failed. And that's why I ran for the education board. And so with that said, I want to say that shouldn't restrict it to 3 to 5, because every child may require more than 10 sessions. Okay, and then let's be for real. Department of Mental Health is overwhelmed. They too have lack of resources. I was listening to the director, Therese Ariola, when she said how many counselors for the entire island. There's a shortage of manpower everywhere. We have to utilize our resources. Let the superintendent decide that with the education board, and not everybody's going to be happy. Let's admit that. Not everybody's going to be happy. But the goal at the end of the day is the students that we serve. And let's face it, not every child, because if they come from a good home, if these children had full support from the community, then who would need the counselors? But we have a society where students, youths are committing crimes much earlier. I'm talking big crimes, intensive crimes. We have students that the parents don't enforce them to go to school. The school system has to go out there and look for these students that fall to the cracks. All I'm saying is that please don't restrict it to 3 to 5. Come to a happy medium. I'm just saying that's just extremely little.
Okay, Ms. Cepeda, we got the 3 to 5.
Okay, I know. And then I wanted, because, I'm passionate about this particular part of this. And then the other thing that I'm really bothered by is when it says here, to inappropriate duties, school counselors are not to cover the classes, not to assist the 504 disability. If we can have a janitor be in the classrooms because the teacher is not there, or a school aide, then why can the counselors? And I'll be the first to tell you that when I was in the Board of Education, we directed the superintendent to get everyone from the central office and put them out in the classroom, because the priority, again, is the children. We don't want to waste 6 to 8 hours in a classroom with somebody. I'd rather put a counselor in the classroom if need be. The one-to-one school aides, the janitorial workers, they're overwhelmed. Let alone, they don't have the educational background. It's not to put them down, but they don't have that background. So that I am really bothered by, because as you know, Senator, you were with me earlier. The charter schools, the teacher is a school administrator, and if they have to wipe and mop the floor, and fine. I'm saying if it works for them, then why can't, and I understand DOE, I understand the government of Guam, they have scopes of service, they can't certain duties. But the student is not going to be left in the classroom because a counselor refuses to be in a classroom for whatever reason. And I'm not attacking anybody in particular. I have a problem with that. Restricting them, you let the superintendent do his due diligence, whoever they may be, to decide that. But to restrict them and say counselors, then before you know it, you're going to have school one-to-one aides or school aides say, I'm not certified. I don't even have a bachelor's degree. And you want me to be put in a class for 6 hours and to be paid that, what a teacher gets paid? That's opening Pandora's box. I'm just saying whatever the counselor's reason for that, I'm just saying my reasoning is if they need to be put in the classroom, allow the superintendent and the Department of Education to do that. But that shouldn't be restricted only for counselors or certain specific for what cause? Who's going to serve? Is it going to serve the counselors because they don't want to be in a classroom? Or will it serve the student? I go back to asking that question. The question should be, the student should be served at all times. And so I have that concern, and I go back to, it takes a village to raise a student, to raise a child. And unfortunately, that will require the senators, the mayors, the priests, the deacons, the parent, the grandparents, godparents, friends, counselors, school administrators. It takes all that. And no one's an exception to that rule. So I'm here to say the only reason why I really oppose this bill is for those two reasons, Senator. Okay? And I hope the serve, because I heard everybody and I hear the passion. And that's the only reason why I, as a member of the charter schools and a former member, elected member of the DOE board, and even with Academy of Our Lady of Guam, I'm just saying that if they need to be put out in the classrooms because the need is there, then the counselors have to do it. Teachers are innovative. They have to, not every teacher liked a DI. When they did away with the DI, not every teacher wanted the DI to be removed. They wanted other options. But teachers worked within the means and the policies put before them. The counselors should be the same way. Because the school system, let's face it, there is a lot, and we're talking ratio. Let's be for real. There's a lack of everything, a lack of certified school teachers, a lack of school administrators, a lack of counselors. But there's not a lack of students. We have a lot of students. And they're let's face it, our youth are in trouble. Our youth is in trouble. They're crying out for help. They're screaming for help. They're committing crimes. And the solution shouldn't be the crime. The solution should be they should graduate. And how can they graduate when suicide is extremely high? We have like the highest per capita as far as suicide is concerned. And I heard the professionals say that they're not the professionals to do that. Then who is? I ask, who is? When a mother is left with saying that their child is thinking of hanging himself or shooting himself or whatever it may be, is the mother equipped? Is she a certified mother? She's a mother who loves and cares and will do whatever is necessary to get assistance for her child. So if the counselor should have that kind of mentality. And if I'm not here to argue with anybody, I'm just here to express my input in regards to this bill. Okay, and those are the issues and concerns that I have, Senator. Thank you for your time.
Thank you, Mrs. Cepeda. We'll now call on Miss Gina De Guzman for your testimony. And then Bryce and Edward will call you after.
Okay. Thank you, Senator. Thank you for allowing us to have this opportunity to actually speak on behalf of the school counselors. And when this bill is being drafted, one of the things that I actually checked, or before we actually get to talk about this evening, I went ahead and checked if there are other states that actually has the same bill for school counselors. And I did find one state, New Hampshire in particular, it actually has almost similar bill that was actually introduced as part of their law, to where it covers the scope of the responsibilities of school counselors that mirrors the ASCA model. So one of the things that was discussion earlier is that why is it mirroring only ASCA? Because that's actually nationally accredited or nationally known as the guidance for the school counselors. And if this bill will be passed, we're not the only states in the United States that has this kind of law or legislation that actually defines the role and responsibility of school counselors. So that's one thing that I would like to share to the panel this evening. And as a school counselor, I'm actually Ms. De Guzman from Simon Sanchez. I'm sorry, I didn't get to introduce myself. Kind of nervous here. But, one thing that for me as a school counselor, I personally believe that preventive services versus responsive services is are both important. But when we talk about preventive services, which can be done when we are focused on our responsibilities, will cover more students compared to responsive services where you're only responding to 1 or 2 students. If we're able to do our programs, we can cover more students and so teach them about mental health, academic, social, emotional. We can cover everything that our student needs. And it's very important because preventive is better than cure, as they said. So with us being allowed to do our duties, focus on the needs of the children, then we can cover more students and not just focusing on the responsive services, although responsive services is very important. So when we talk about responsive services, that's when there are some critical issues with the students, like responding to like trauma and everything that comes to our office, and we need to respond immediately. That includes the suicidal ideation. So if we have those, we can respond to that. But if we're able to educate our students about more on the social emotional learning as part of our program with the guidance of ASCA, then we can actually cover more students. That's basically what I would like to say. Thank you so much.
Thank you, Ms. Digisman. Mrs. Regis?
Yes, it's Mrs. Regis. I am happily married. I know that's besides the point here. But I'm a school counselor. Thank you. I'm a school counselor and I'm at CL, Taitsino Elementary School. I love that school. I was also a counselor at Estumbo Elementary. That was my first school as a counselor. And both schools had made me grow into who I am today. And I've learned so much. I really have. And I'm going to try to make this as short as I can. But with this bill, again, I've read it. And again, I think I have a lot more questions. I'm not really on the ball with it just yet. And I think a lot of it is, and I think other people who are opposed to it, you know, I can see your concerns and I understand you because I have those same concerns as well. At the same time, I know counselors have been waiting and been wanting to get their voice heard. And I get that. I 100% get that. And I think a lot of it is we need to really work together as a team. And after COVID hit, so many things has happened. My students, me seeing the students that I'm seeing now has almost doubled. And every time I see that my students coming into my office needing my help, it's been giving me such a pleasure to help them because I knew they need help. And we all need help for that matter. And I think right now, the department, we need to work together. And I know it's hard. And a lot of the times, right, we have all these different ideas. How can we help, right? And I think the bottom line here is hopefully with this whole thing that has happened with having this bill finally coming out, hopefully maybe we can really work together as a team. And maybe we need it. Maybe we need that bill and maybe not. But the point being is that there's always going to be baby steps, right? And we can't just get it like that. I wish we could. And I tell that to my parents. I wish our students can just stop misbehaving and just with a click of the finger, snap of the finger, everything is going to be hunky-dory. But the reality of it is it's work and it's sometimes blood, sweat, and tears sometimes. And I am just, at this point, I'm really cautioned with it. So that's where I stand. Thank you for giving me the time to speak how I'm feeling. Thank you.
Thank you, Mrs. Regis. Jonathan? I'm sorry, did Edward? I'm sorry, Edward. Edward, is it okay if Jonathan goes first, or would you like to go first? It's okay. Okay, go ahead, John. And then Edward, I'll call you. Sorry, you moved from the screen.
Hi, good evening, Senator Nelson, and everybody in this panel. Coming from 24 years of education experience, 13 years of teaching, and of course, coming as a guidance counselor for 7 years, you know, I was vocal and then moving into the administrative side. So I'm kind of still coming from 3 different hats as a teacher, counselor, and administrator. I disagree with this bill. It's because there's a lot of this inappropriate duties that's stated here, but we still do it as the scope of work as guidance counselors. And if you were to pass this bill, you're gonna have this like domino effect, like Mr. Santos mentioned, Mr. Zetti, and so on. So overall, I think it needs to be revisited, and just to see the communication between administrators and counselors. I think looking at the ASCA model, you know, I did it once. I tried to do the ASCA model once, 1 year, and then next year I just gave it as a, you know, like a wheel to continue with the department, and then things piled up, you know, different duties. But one thing about the ASCA models, when we have this administrative conference with admin and counselors, that's when you put it on paper, what duties you need to do. In the ASCA model, in that sheet, annual administrative conference, there's a portion there that says non-school counseling duties, 80 to 20%. If you see these other inappropriate duties in here, you know, I've done it as a counselor, computing grade point average. I had to make sure GPAs are correct with these students, scheduling, maintaining school records, so on. Again, we do go 110%. It's not stated in a manual, we don't get a book, but the thing is, what is best for the mission of the school and for student needs? So overall, I know it's long night. I just say I disagree. Being a board member for the certification office for about a year because I moved into admin, I'm not wearing my admin hat. I'm working as a guidance counselor hat, and I may be one side, I may be the only one in the other side, but I'm still think this bill should not pass. That's it. Bye.
Thank you, Jonathan. Edward?
Fade, thank you very much. My name is Edward Masi. Who am I? I am the department chair at Tizen High School. I support the bill because I need some sort of sheet that tells my coworkers what I'm supposed to do. As far as these extra duties, DWA, scheduling, leave that to me as a professional, flexible, adaptable, loyal, to tell my boss, say, boss, I know we got DWA this year, and I notice you haven't identified somebody to cover it. It's not in my scope. However, because of the department and the number of counselors we have, as a department, we can cover it. So boss, even though we have a bill from the senator that say, you know, you cannot do this and you cannot do that, boss, we can do that. Let us have it. But to sit on the other side, outside of my counselor office and look in and tell me, oh, as a counselor, you should do this and you should do that. Or you never sit on my desk. You never talk to my student the way I do in my capacity. I'm a special counselor. No student at my school, at the middle school, feeder school, will have anything bad to say. Because I do my job professionally. I love my job. But I've been accused of not having enough to do. Oh, counselors don't do anything. They sit on the laptop and YouTube. All right. And then as soon as there's an issue in the school, call the counselor. Call the counselor down here. We need counselor input. Okay. And not to mention night school and summer school. You pay the teacher extra money to night school, summer school. Who the teacher call when they're having issue with students during night school and summer school after hours? Okay, I'm there. The student know, oh, don't worry, Mr. M will be there first day of night school. If you need help, just let him know, and then he's right there. Okay, but give me the paper that I can show my coworkers and my boss and say, this is what I'm supposed to be doing. If you have other things outside of this for me to do, because I love my school and I love my boss and I love my teachers and I love my students, let me assess if it can fit into one of these that I'm already have to do. But thank you very much.
Thank you, Edward. We appreciate that. It's a very colorful testimony. It's the best one all night. Okay, now if there's no one else that would like to speak, oh, Miss Evangeline Iglesias, would you like to give testimony?
Yes, thank you. Thank you and good evening. I know you all have been here for quite a while, but Evangeline Iglesias, principal of Weddingale Elementary School. First off, just looking at the bill that we have here, that we've been discussing throughout the evening. First off, the intent, I understand where it's coming from. Our counselors have gone through so much in the years, and they've been advocating for them to be heard. And I know that even my counselor at Weddingale has shared with me, and no matter what, looking at the bill, she continues to support whatever vision and mission we have at the school. She never says no whenever I ask her for support. However, there are some underlying messages that I'm reading throughout the bill that needs more refinement. However, I think that with this bill, it's really opening up a lot for administrators and what we do, and what like Ms. Vanji Cepeda had mentioned. It's going to be mentioning a lot of things that can come out from this bill. But the intent of the bill that I see, I really appreciate what the counselors are trying to say. They want to be heard. I've heard from my counselor. We sat down and we discussed this bill. And no matter what, she always supports. And I'm sure a lot of the counselors and a lot of the administrators here will say, we go through these, we work collaboratively and we work together. However, they need to be heard. And I know that they've tried to express their concerns. They've written it down. They have the discussions in their meetings. But I think that what we need to really consider throughout this conversation is that they want to be heard. They want to follow what the ASCA model says, because they need guidance. They need a goal and a vision of what their purposes are. And, just like school administrators, we have a vision, we have a mission that we support our superintendent and our board members. And the counselors are speaking up tonight, and they want to be heard. And I think we need to sit down very intently and listen to what they have to say. But I think the bill needs some refinement, because I think that it's going to open up a lot of things if it gets passed, in regards to some of the duties and responsibilities that's going to be a burden to the Department of Education. And they do a lot. In fact, they're even continuing to help us out doing the district-wide assessments. And that's even beyond what they're normally doing in a typical day, which is their vision is to ensure that they provide support not only to the students, but to their families. Even to us administrators, sometimes I'll look for my counselor and say, I need therapy, I need help, I need to have support. But my counselor is not a therapist, she's a counselor. She's there to assist us, to provide support. And I think, Senator Nelson, we really need to have that conversation within the Department of Education and how we can better support our counselors and what their intent and what they want to do. Because in a normal day, they do so much above and beyond. And I can tell you, sometimes my counselor is leaving school after I leave. And so I just want to make sure that, we hear what they're saying tonight and we support what is intended. But we really need to look at the bill. It really doesn't stipulate what we can do to collaboratively work together in a common vision, because, from the front of the bill to the back of the bill, it talked about collaboration and support for one another. But when you put it down in the bill, it kind of contradicts some of the areas where we're at for our vision, and that is to help the students in the end. And I think that we really need to listen to what the counselors have to say. I think the superintendent, the board, all of DOE needs to really sit down and say, these counselors are speaking up and they want to be heard. I've been with the department for quite a while, and I've been through times where we didn't even have enough counselors, and the University of Guam had to provide some support to get counselors on board. And I'm really happy to see that we now have counselors in the schools. But that's what I have to say, is that we need to really look at what this bill is trying to say, and that is supporting our counselors to provide their vision, their mission, using the ASCA model, but then really look at it carefully as far as furthermore in regards to how we can support one another with the same vision. Thank you.
Thank you, Mrs. Iglesias. Annie Palomares? Annie, did you want to give testimony?
Hi, Senator. Thank you for taking the time, and thank you everyone who's being here. I know we've lost some people, so I'll make it fast.
Can you please turn on your camera?
Hi.
Great, thank you.
I'm a counselor at high school, and I've been a counselor since Okuru opened in 2008. Okuru's been open. My ratio has always been
Annie, I think you're breaking up. I think your bandwidth is, I think you need to maybe reset your modem or your workstation, because you're breaking up.
Hello, Senator, can you hear me better?
Okay, maybe you'll just have to give testimony.
Can you hear me better?
Yeah, maybe you'll just give testimony without your camera on.
Okay, so thank you. So I just want to say from the inception of me being a counselor, I've always had such a high ratio. So to the parent who spoke up, I hear you and I apologize, because like Edward said, as counselors, we love our job and we want to be there for our children. But when you have such high ratio, some kids are just going to slip through the cracks. And especially when the school, I mean, it disheartens me to hear that of all the administrators who spoke up, I have to say the only one that supported this bill was Ms. Evangeline. And thank you for doing that, because our job as counselors need to be protected. Our roles need to be protected. Let me ask you, are teachers' roles protected? Are parents okay if teachers don't teach and be limited to 28 kids per class? So why would you do that to the counselors? Give them such high ratio, and knowing that your counselors are there to run all the other programs, do clerical duties. I mean, as a kid growing up, when I see my counselor, I've never even met my counselor. I didn't even know there's such a thing as scholarship and the 50-to-1 ratio to get merit scholarship. No counselors have ever told me that. Had I known, I would have worked harder in high school to help my parents save up some money. But no counselors have ever told me that. In my eyes, counselors stick and glue their eyes to their laptops or computers. In this day, counselors continue to do the same things. You know what I love about my job is when I help a kid and I help them change their mindset and to be better individuals for the society. But do I get to do that? No, because I have to do all these programs first. I constantly ask the district to give us that ratio. Even 1 to 250 is still a lot, especially in the high school where you have to do scheduling and it's manual. Let me remind you that. We review the students' grad stat, now also added service learning hours, and then we have to call the kids out and tell them where they're at and go through it one by one with them. It's all manual. it's a lot on the eyes and concentration. So yes, counselors are going to mess up because we don't have a computer system that can easily catch those errors. In earlier, some of the admins who spoke up regarding needing counselors to cover classrooms, to do the screeners, to do all those things. Now, if you listen to all of that, when do counselors have time to really talk to the kids and to help plan for their future? So I'm grateful that, Senator, you're finally taking the time to listen to us, because we have poured out our outcry. We don't even have a budget to train counselors to like the way the teachers do. As Stella said, counselors have to pay out of their pocket, and or we have to fundraise. Why is our counselors continuing to be like the employees at GDOE that's being neglected and not supported? Why? I could tell you why. Is because we need people to fill in the holes, people to do the tasks that teachers can't do, admins can't do, or they need more hands to help them coordinate. But that's not the jobs of counselors. Counselors need to just counsel. Teachers need to just teach. So I'm in support of this bill. And I hope, senators, you hear our voices. I want to help my students and be a better counselor for them. And I can't do that if I'm not given the opportunity to. And my students can't just be a name or number to me, to be unique individuals to me that I know about their background, what's happening in their homes, what do they need so that they could accomplish getting to their post-secondary goal. But I can't do that if you keep throwing stuff my way. And I won't say no to you, to my boss, like Edward said. We're just gonna continue to keep taking it in and be team players. But when kids get slipped through the crack, whose fault is it? When they take the wrong classes, whose fault is it? When they're going through social emotional issue, whose fault is it? It's all going to point towards the counselor. Thank you. Thank you, everyone. Have a good night.
Thank you, Ms. Palomares. We exhausted the list of those who all wanted to testify. So now I'll be moving on to my colleagues here. Senator Brown, do you have any questions or comments for our on the bill tonight?
Thank you very much, Senator Atta. I don't have questions. I think I've heard a lot of testimony, certainly from different perspectives with regards to this bill. I hear the concerns the counselors are raising, but at the same time, I'm a little concerned about us legislating this process. I mean, can you imagine all the positions in the government of Guam if the route that we're going to take now to determine what the job description is going to be and what the parameters of that are going to be?
Sorry, forgive me, Senator Brown. We just got a notice from AV. We're going to have to take a quick 5-minute break so that we can reset.
Okay, all right.
We're just going to do a quick recess and we'll come back. I think in five minutes is usually the time that it takes to do a reset.